ಬಿಲ್ ಇಟ್ಟು ಹಚ್ಚಿ ಆಮೇಲೆ ರೊಕ್ಕ ಇಸ್ಕೊಂಡು ಅದು ಪೇಟ್ ಮಾಡಿ ಮುಗಿದು ನನ್ನ ಗಾಡಿ ನಾನು ಸಿಕ್ಬಿಡ್ತದೆ.
Don't see the picture alone, see that curiosity. Can you understand? Right? So you should be always curious in life. Adyak hinga, idak hinga, avayak hinga. To the crematorium ground. Right? Ba, hogun ba. Matte yen tinnona. Gobi manchuri sab crisp ಮಾಡಬೇಕು. ಹಾ ಇಲ್ಲ ಗೋಬಿ ಮಂಚೂರಿ ಮುಗಿದೈತಿ ಅಂದ್ಕೊಂಡೆ, what will be your response? ಮತ್ತೇನೈತಿ? Don't compromise your willpower. Gobi manchuri I have to eat, right? Today I have to eat. If there is no gobi manchuri there, say thank you, all the best, do well, go to the next shop. Can you understand? And next shop also there is no gobi manchuri. That is willpower. Can you understand? Once you decide something, sticking on to that, irrespective of all the problems, continue to do that. That is willpower. If you are reading, suppose you have decided to read 3 pages, you need to complete 3 pages and retain that focus there, irrespective of what is happening outside. Can you understand? That is willpower. Keeping your concentration at a particular place which you have decided for a longer period of time without getting distracted is willpower. Can you understand? So have that willpower. And the third most beautiful, and I'm not talking about, so my dear friends, mind your mind. Focus, curiosity, happiness. If you can do this, beauty manifests. Okay, all of you say now, I am the best. Doubt bartitilla? Something tells inside your head now, you are best. Can you understand? That is called, see, there is a dreamer inside us, there is a doer inside us, but there is somebody in between, that is doubter. And I have given him name Mangu. Everybody has Mangu in the mind who stops you from doing something. Okay, become friend with him. Go ahead, go to my YouTube channel and see Mangu. I mean, Yashassige Ekagrate, something like that. Ali Mangu, I have talked about Mangu. Right, you can listen to that. Right, I'll not continue here like so. But Mangu comes in between and it says, if I say, hey, let us dance now, then what you'll say? Dance. Who says this? In the bathroom you will dance. But here, dance, here, a conference. Mangu, please understand. There is a Mangu inside you who wants you to be like this only. He don't want you to be somebody else. But if you challenge him, that requires willpower. Can you understand? So focus. Right? Okay, I say now, I am the best. I want the best. I will achieve. Understand? This is the mantra you need to carry. Now, all of you say, rest of my life is best of my life. ಇವತ್ತಿನ ಮಟ್ಟ ಏನಾಗೈತೆ, ಅಭಿ ತಕ್ ಜೋ ಹುವಾ ಹೈ छोड़ दो. Don't regret now. ಅಯ್ಯೋ ನನಗಿದೆಲ್ಲ ಗೊತ್ತಿದ್ದಿಲ್ಲ, ಅರ್ಧ ಜೀವನಾನ. Then victim consciousness. Can you understand? ಆಗೈತಿ ಏನು ಮಾಡಾಕತ್ತಿ, ಈಗ ಗಯಾ ರೇ ಚಲೋ ಯಾರ್. आज से what is over. Please understand. What is over. Let's go ahead now. Rest of my life is best of my life. ದೊಡ್ಡವರು ಅನ್ಬೇಕು, ಇಲ್ಲಾಂದ್ರೆ 108 ಬರ್ತೈತಿ. ನನ್ನ ನಾಲ್ಗಿ ಬಾರಿ ಕರೆಕ್ಟ್ ಐತಿ ಮತ್ತೆ ಹೇಳತ್ತೀನಿ. Because when everybody is praying for it, and if you don't pray, then God will look at you. Hey, he has some problem here, call him. Can you understand? Please. Okay? Especially elderly people never talk about death. If it has to come, it will come. And never use this word. हमारा तो सब हो गया, सब आपका भी. हमारा सब हो गया, आपका. ನಮ್ದೆಲ್ಲ ಮುಗಿದೈತಿ, ನಿಮ್ದು. ನಮ್ದು ಇನ್ನೆಷ್ಟು ದಿವಸ ಅವ್ನು ಸಂಗ್ ತಗ್ತೈತಿ, ಕರ್ಕೊಂಬ ಅಂತಾನ. Can you understand? Don't use that language, sir, because your language makes you. Drushti se srushti banta hai. Can you understand? Okay. And the last one, God. In difficult moments, seek God. In quiet moments, worship God. In painful moments, trust God. In every moment, thank God. So this moment, thank God because He connected you people with my life. Right? What is it?
Thanks a lot. I would like to call upon all of you to stand up and have a round, big round of applause for sir. More louder. Thanks a lot, sir.
Patient for you. Right, right. Sir, I thank God because He connected us. Okay, thank you so much. I thank Huli sir. Love you. Take care. Right.
Next. Thank you. Frank, acknowledge my gratitude of thanks to the entire team of this BVVS Sangha, management team, the organizing committees, the teaching, non-teaching faculties, the technical assistants, the students, all the delegates, the awesome invitees, the luminous speakers, everyone. Congratulations for the grand success of this event. A big round of applause, a thunder, please. Thank you. Special thanks to Dr. Arun Holi sir, Dr. Ravi Kotnar sir, Dr. Milind sir, Dr. Nidhi ma'am, and Dr. Fatima ma'am, Pradeep, Dr. Rekha, Dr. Pradeep, and Dr. Amresh, and anyone if at all miss, and Dr. Sheikh ma'am. Okay, if anything I miss, please excuse me, because I'm in a hurry to just sum up a little. Yeah, ready. Pradeep, special thanks. Okay. So, the session started with a very ice-blowing beginning. The ice was broken with such a good thing, making everyone to stand, breaking the monotony, because all were in a sleeping mood and breaking the monotony. Congratulations, sir. Really, congratulations for this wonderful beginning. Then the clip that was shown, yeah, you see, always what I believe, the truth lies with only one person, while the 9 speaks only about glamour. You see the picture which said, thousands of them congratulated him for capturing that moment, but it was only one who thought the emotions behind that and who had a very different look. So this is what we need. We need to run with emotions, not just materialistic life. What happens whenever there is any incident, accident, we are more focused on capturing that with our mobiles rather than helping them. Yeah, this is what I learned in basic care and life support because I was an instructor there. Thank you for that, sir. That was a very good message. Then there were 3 video clips that were displayed. The first video clip, it reminded me of तारे ज़मीन पर आमिर खान, हर बच्चा खास होता है और ये केवल बेस्ट टीचर को एहसास होता है. Yeah? Are you with me? Yeah. The second video clip that was about Kantara movie, wherein how to control yourself or how to master controlling the others was depicted. It was very beautiful again. And in the third clip, कुछ रिश्ते खास होते हैं, wherein what we say, parents are the first teachers of the children and school is the first home. That is what I realized from that. Yeah, because our children are all being motivated by our activities, sensibly or without our consciousness even. So that we need to. And then one more important, I'm reminded about the Swami Vivekananda's quote, the infinite library of the universe is your own mind. The external world is just an occasion which sets you to study your own mind. So friends, explore yourself, explore the conscious and the subconscious mind in you to get good results. Lastly, take home message. Between the dream and the doer, there is always a doubt. So this reminds me of APJ's quote. Sleep is not that which you, dream is not that which you see in sleep. Rather, dream is that which doesn't let you sleep. Thank you so much. Thank you. Love you all. Have a delicious lunch. Good day.
Hey, sir. Then we'll have delicious lunch.
Thank you, ma'am. Thank you, sir. I thank the today's resource person. Please give a big hand to all the Thank you, sir. I now request Dr. Deepak Nayak to welcome them with a floral bouquet. Please give a big round of
for giving me a chance to host being a part of BVSS team. It is a great privilege to be among galaxy of intellectuals here. Today also, we have a very distinctive speaker among us, Dr. Manpreet Singh Bindra, a man who deals with cardiology and oncology and critical care medicine. I fall short of words to introduce such a great personality. Sir has been a resource person at many conferences, both national and international level, where his topics of presentations were apart from cardiology, oncology, gynecology, and management of lifestyle diseases, etc. He has conducted n number of workshops and trained more than 600 plus doctors in hands-on training workshop in managing critical care centers. He has treated more than 26,000 patients in more than 24 countries. He has a certification in Blue Code Emergency Medicine by American Heart Association. He has been also certified a batch flower practitioner by UK Center. He has published Clinical Desk Reference Handbook in Homeopathic Cardiology, 3 editions. He also has a book on emergency medicine in homeopathy and homeopathy on oncology in press. He has received many awards and felicitations like National Healthcare Excellence Award, Kent Memorial Award, the Modern Clerk of Homeopathic Award, and National COVID-19 Excellence Award. With this cut-short introduction of Dr. Manpreet Singh Brindra, I welcome you on behalf of BVVS Homeopathic Medical College, Bagalkot, for this scientific session. I have another personality here, an extraordinary person, a man par excellence, Dr. B.D. Patel. He himself is a guide to n number of students spread across the country, as he was a former principal of Government Homeopathic Medical College, Bangalore, as well as Chandigarh. He has also been a former member to Advisory Committee of Government of Karnataka. He has also holded a membership at KPSC, that is Karnataka Public Commission. He has been practicing homeopathy since 1973, almost 50 years now, and has 3 clinics in Bangalore. I won't be wrong by saying that this is the only way of helping society in true humanitarian way to bring out awareness of homeopathy in its true sense. I really feel immense sense of pride to host such a session wherein my students are there, and which alights a sense of responsibility to each one of us as a part of this holistic science. With this, I present to you both the resource persons, and now I would request Dr. B.D. Patel to speak a few words.
Thank you, Dr. Sir. Friends, in the afternoon, you want to insist, and then he will be talking on the subject called as cancer. Cancer, the moment you know anybody else, you are having cancer, he will not die with the cancer, he will die with the fear of the cancer. That is the state of affairs. Why don't we pick it up? Terminal cases, non-terminal cases, cardiac cases. So let us all keep our mind and heart and time invest in listening मन की प्रीत बातें करने वाले मनप्रीत सिंह जी बिंद्रा से. May I request Manpreet Singh ji to please go ahead with the project.
Yes or no? No. So first you have to be a doctor, then your journey to become a physician and a homeopath starts. Remember this. And this is why we people are one step ahead to the allopathic fraternity. So now we are talking about cardiology. How many of people know that what is chest pain? Students, first the MD scholars are there, please raise your hands. What is chest pain? Yes, sir, please. Can we have one more mic in the audience? Because see, my sessions are all interactive sessions. I am not a teacher. I will just discuss what I know about the medicine, and that will be all my experience with you. What is chest pain? Okay. Anybody else? Something else? What is chest pain? Pain in the cardiac region. Anybody else? Pain on the chest. Anybody else? 5 homeopaths, 5 different definitions. Why? Chest pain is chest pain. Somebody said cardiac, somebody said pectoral, nobody told retrosternal. And this language barrier between homeopaths and allopaths is the biggest challenge, let me tell you. Because I have been trained by the allopathic doctors more than the homeopathic doctors. And I know that they do accept that homeopathic doctors don't do the medical terminology in their day-to-day practice. And this is the biggest challenge for us. So what is chest pain? It is one of the most common challenging symptom for the cardiac patients, because any cardiac patient will be having the first symptom as the chest pain. Now see, somebody will come with you, this is the region where I have pain, right? And somebody will come, this is the region, somebody will say this is the left arm, right arm, left subscapular area, anybody can be the radiation of the pain. And remember, never say that chest pain is the only cause, behind it is the cardiac. What are the other causes of cardiac pain or chest pain? Yes? GI, okay, what else? Carditis, pericarditis. Osteo, okay, what else? What else? Injury, okay, what else? Right, already done. What else? Right, what else? Now, how to differentiate all these? Herpes zoster, okay. How to differentiate all these? Examination. Okay. So today we will be discussing that what can be the, just I am telling you this because it should be in your approach, that how you deal with the symptom. Chest pain is the term which patient will use, that yes, doctor मेरे को chest में दर्द हो रहा है, छाती में दर्द हो रहा है. And for the patient, like sir was saying, cancer is like a death warrant. The same thing, chest pain is like a heart attack in 90% of people. And 10% in our country who say, कोई बात नहीं, acidity होगी, ठीक हो जाएगा. Right? So make sure you are confident about your differential diagnosis. And never believe that allopath will diagnose and you will treat. This is happening with us, that 80% of patients come from allopathic doctors and they are pre-diagnosed cases. So now, first, duration of the pain, it matters because it will change the underlying cause. Quality of the pain, location of the pain, and the associated features. First is the stable angina, which we call the forefather of the chest pain. Now, what can be the duration? 2 minutes to 10 minutes. This is the general duration of the stable angina. Quality will be squeezing, tightness, burning, and heaviness. Always remember, cardiac pain will never be on the tongue of the patient. हार्ट अटैक का पेशेंट आपको बोल के नहीं बता सकता मेरी छाती में दर्द हो रहा है. दिस इज व्हाट यू शुड रिमेंबर. द पेशेंट विल होल्ड हिज फेस लाइक दिस, आई हैव डिस्कम्फर्ट ओवर हियर, रादर देन सेइंग पेन. So this is a huge difference. Just by listening to the patient, a simple interpretation of the clinical symptom can tell you what is the cause behind it. Then we have the location. It can be retrosternal, radiation can be to the shoulders, to the arm, to the jaw, and to the neck. Associated feature, what we call the concomitant symptoms in homeopathy. What can be the associated feature? S for gallop. How many of you know what is S for gallop? What is S for gallop? Yes? Be open, don't worry, नहीं पता होगा तो I will tell you. I will even let you know that how it sounds. What is S for gallop? Students? Yes? Fourth heart sound? Third heart sound? It is normal or pathological? Yes? All the time? Not sure. Now this is the answer to his question. And we are sitting in MBBS college, I think? Yes. I hope there is no MBBS doctor here, huh? Because I will talk side by side about them. So as for gallop, we will discuss in the later slide that this will be accompanying symptom. And remember sign, and remember whenever you listen S for gallop in a patient, immediately have to be admitted in ICU. And you will do this only when you know what is S for gallop. Otherwise you will say, heart से कुछ sound निकल रहा है, I don't know what it is. This is most of the time some students say me, sir, I have a patient, there is a different sound in the heart. I ask him, which sound? I don't know. Now on the phone, how can I tell which type of sound is this? So heart sounds are the gateway to the diagnosis, always remember. Only listening to the heart, you can tell what is happening inside the heart. Then is the unstable angina. Now what is the difference between stable and unstable? Pain is Right. So duration will be 10 to 20 minutes in unstable angina. Quality will be more severe, more distressing, more discomfort will be in the unstable angina. Plus location will be same, retrosternal, addition to jaw, shoulder, neck, to the arms. And associated feature, again, it will be having S for gallop. Now what is S for gallop? That we will discuss. Slight exertion will precipitate it. This is the difference between stable and unstable. Now coming to the dead end, what we call the myocardial infarction. This is what we call the myocardial infarction is what? Heart attack. Speak loudly what it is. Duration is more than 20 minutes and it can be variable up to 30 minutes and even more than that also. Because 30 minutes is a very crucial time for such patients. Quality will be most severe of all chest pains, most. And this patient will not be able to interpret. He will just hold his hand, squeeze his chest. This is what the discomfort you will notice in the patient of MI. Location again same, radiation is also same. Impending heart failure and arrhythmias occur in these patients. Now see, if we talk about the sequence of cardiac arrest, can anybody tell me how this patient can die? Anybody, what will be the sequence on the ECG monitor? Yeah, please give mic. What will be the sequence? ST depression, then what? Okay. Right. Right. Anybody else? What will be the sequence? ICU में किसी ने कभी ड्यूटी की है आप लोगों से? Anybody? Yes, sir. Please tell. Good. See, this is how the difference speaks. He has done duty in ICU and he can tell it. So Dr. Arun sir is there. Where is principal sir? He's outside. Okay. So my request to all the management and the faculty, at least you people have done a very tremendous job. So do one thing on my request, that introduce such clinical knowledge to your students. This will make huge difference, you will see. Why we homeopaths are behind the allopathic system? Just due to all these things. We have wonderful medicines in materia medica which can work faster than the sorbitrate, which can work faster than the atropine. But we don't know how to apply it because we don't know how to diagnose. Aphorism 3, what Dr. Henneman says? Knowledge of disease. And our doctor says, homeopathic doctor don't need to diagnose a patient because we do treat as a whole. Sadhu, Santo, Mahatma wali baat. We treat patients as a whole, no doubt in that. This is the concept of homeopathy. But in the whole, does not it come the diagnosis of the disease? Why we are lacking it? Why we people don't do the ECG of the patient? Why we people don't go for the lab investigations? Why? How will you diagnose? How will you prognose the patient, whether it can be recovered with medicines or not? And that will come only when you have the knowledge of practice of medicine. So, associated features, unrelieved with nitroglycerin. This is what they call the sorbitrate, the sublingual tablet in the allopathic system. Next is the pericarditis. This will be the friction rub. Now, how many of you know what is friction rub? When there is pericarditis, there will be the, do your hands like this. The sound you are listening, the same sound you will listen in the patient. That is what we call the friction rub. Sharp stabbing pain, associated feature, relieved by sitting up like this. Again, friction rub I told you. Then comes pneumonia and pleuritis. This is a common thing we deal in day-to-day practice. Sharp stabbing and burning pain. Location is unilateral and localized because the affected lung will be having the pain only. And there will be the rales or crepitations. This is the part of the lung sound. Rales, you understand? Yes? Right. Gastric pain, the cheater. Why this is cheater? Because 80% of allopathic hospitals run their emergencies on this. The patient has a severe gastritis, go to the hospital, they let them into the emergency, they do the ECG, they do the angiography, and after 48 hours they say, you are okay, you can go home. And this is a business nowadays. And if you know what is the difference between the gastric pain and the cardiac pain, you can save the patients from unwanted angiographies. Duration will be 10 to 60 minutes, pressure, burning and tightness of the chest, plus postprandial, after meals, that will be always here. Precipitated after the meals, relieved by antacids. Other chest pain mimics, herpes zoster, somebody told, musculoskeletal. Always remember, if patient tells you that there is aggravation of the pain by pressing the chest, that is 101% musculoskeletal pain. Clear? Then we have the gastric ulcers, which will be relieved by food, opposite to the gastric pain. Now coming to the dyspnea. So clear with this? Any doubts? I will go with the doubts side by side. Any doubts? No. So dyspnea comes, what is dyspnea? Difficulty in breathing, shortness of breath, and why it occurs? Silence. Why it occurs? Why somebody has dyspnea? Which system works behind it? Only respiratory? Neuro? No role? Efferent, afferent. Without brain, nothing can happen in the body. Nothing can happen. Even the pain starts from the brain, from the pain center, what we call. You should have a little idea about it. Respiratory sensations are the consequence of interaction between the efferent and the afferent motor air ventilatory muscles, the neurons which work behind it, right? So this is the grading classification of dyspnea. New York Heart Association grading of dyspnea. Grade 1 is dyspnea with unusual exertion. Grade 2 dyspnea on ordinary activity. Grade 3 only on the slight exertion, and grade 4 is the dyspnea on the rest. Always write NYHA grade 1, 2, 3 or 4 when you are writing the symptom of dyspnea in the patient history. And this is the difference between allopathic doctor and homeopathic doctor. We write dyspnea, but what extent of dyspnea we never ask to the patient. Because our medicines, does it make any change with the grading in the prescription? The people who use repertory? Yes? We have sub-rubrics for this. Dyspnea on slight exertion, dyspnea on lying, dyspnea on walking, dyspnea on extreme exertion. So you can select your medicines also on the basis of this. Now 6 P's of dyspnea. What can be the 6 common causes of dyspnea? First is the pulmonary broncho constriction, then possible foreign body, then we have the pulmonary embolism, pneumonia, pump failure and pneumothorax. Pump failure here means heart failure. So next is the edema. It is defined as a clinically apparent increase in the interstitial fluid volume which may expand by several liters before the abnormality is evident. Always remember, it is pedal edema, sacral edema, anasarca. Which else? Please be interactive. Either you don't know or you don't want to share. Sir, आप सब कुछ कैसे बताओगे? Yes, please. What are the types of edema in the body? Okay, starting from the here. What is this? Which edema is this? Retroorbital. Then what? Yes, yes, please. Then what? Ascites is which edema? Ascites is which? I just need one volunteer. Anybody want to come? Any student? For the mic, because we will now point out everybody. Somebody come with the mic, please. See, I do generally the workshops, right? So in workshop, what we people do, you know. If you don't speak, I will start pointing out. Yes, sir.
Chronic liver diseases anta.
Okay. Next, which one? Renal edema? Cardiac edema, okay. Just remember, on the basis of the cavities of the body, you can differentiate. Pleural cavity, peritoneal cavity. You will stand here? Right, thank you. So now what is the cardiac pathology of edema? Basically what happens, impaired systolic emptying of the ventricle, this is related to the cardiac cycle. If you don't know, you should note it down, then go and home and remember it. And the impairment of ventricular relaxation, impaired emptying of the ventricles, it leads to accumulation of the blood into the venous circulation, means backflow, right? Then it leads to the interstitial accumulation of the fluid. And ultimately we notice the edema, and this system responsible for this is the RAS, renin, angiotensin, aldosterone system, right? Congestive cardiac failure edema, you can see the picture. The presence of heart disease manifested by cardiac enlargement and gallop rhythm, together with evidence of cardiac failure such as dyspnea, basilar crampes, rales, venous distension, hepatomegaly due to the, hepatomegaly is due to what? Hepatic engorgement, portal hypertension, what we call. Usually indicate the edema which results from the heart failure. Next is the palpitations, what we call the dancing heart. Now palpitations, patient can term them different. One can be thumping, one can be fluttering, one can be in pounding pulse. The sensation can be either intermittent or sustained, or it can be regular or irregular. Palpitations are brought out by 43% cardiac causes, not 100%. 31% of psychiatric causes, anxiety related, miscellaneous are 10% and 16% are unknown causes. So only 43% patients require immediate, urgent evaluation. That is to the cardiac. Premature atrial and ventricular contractions, supraventricular and ventricular arrhythmias, MVP, mitral valve prolapse, aortic regurgitation, all these can be the causes of palpitation. Now the tips, what can be important in palpitation? Clinical point I am giving you. Any patient who has coronary artery disease, the heart blockage, the blockage of the coronary arteries, if that patient comes to you with the palpitation, that is an alarming sign. It can be the greatest risk for ventricular arrhythmia, and once the patient goes into the ventricular tachycardia, from the ventricular tachycardia the patient goes to the flutter, to the fibrillation, and immediately there will be cardiac arrest. This was the sequence I was asking. Now, read what these two doctors, unfortunately these two doctors are discussing. The doctor says, we have reviewed ECG, chest X-ray, echo, cardiac imaging, nuclear scan, CT scan, but still I am not able to find out the diagnosis of the patient. The other doctor was intelligent. He says, sir, let's break down and listen to the heart of the patient. And this is the misfortune of medical fraternity nowadays, that doctors have stopped listening to the heart and the lungs. Directly go for echo, go for cardio, go for CT angio, go for MRI, all the tests. Nobody bothers. Let's listen to the heart first, because heart is the organ which speaks itself. Everything it can interpret, it's in all language. But nobody bothers to use stethoscopes, and homeopaths are the most unfortunate ones. How many of you auscultate your patients, the practitioners? Only 20 to 30%. Because see, not only in cardiac practice, but in all cases, you should auscultate your patient for the lung and the heart. Now, about heart sounds, a gateway to the diagnosis of the heart disease. Only auscultation of the patient can tell you 80 to 85% of cardiac diagnosis, if you are aware about it. And that will come only when you are aware about normal heart sounds, then abnormal heart sounds. So this is about rediscovering the lost art, what we call the lub-dub with homeopathy. Now what are the heart sounds? They are the vibrations which are caused by the closures of the valves. Where are the MD scholars? Please raise your hands. MD scholars? Yes, anybody? Any BHMS student, final year or intern here? Yes, please. You? This red dress, you were raising your hand? Yes, give mic to her. What are the normal heart sounds and how they are produced? Please speak, don't worry. Normal heart sounds.
S1 and S2. Sir.
How S1 is produced?
Closure of the valves.
Which valve?
Mitral valve.
Only mitral?
Tricuspid.
Okay. S1. You? Next to her? S1 sound.
Closure of atrioventricular valve.
Name the valve. No.
Tricuspid. Bicuspid.
चार ही तो हैं, सारे बोल दो क्या होता है. Right? So main heart sounds are S1 and S2. Right? These are the normal sound. S3 is physiological plus pathological. Sometimes it is physiological. In which conditions S3 is physiological? Anemia, yes. Pregnancy. What else? Athletes, yes, good. And S4 sound is always pathological, always. And remember, if you get opportunity to listen S4 sound in your practice, immediately you have to refer the patient to ICU, immediately. S4 means what? It is gallop rhythm. You people have heard horse running? The same sound. Means what? The heart is in strain and pressure. And as soon as it withdraws it, immediately it will go into cardiac arrest. So this is how important these things are. And never believe S3 sound, it can be physiological. Like in athletes, anemia, pregnancy. And now see, if a patient comes to you and you know that there is S1 and S2, and you hear the S3 sound, you will do what? आपको तो heart की दिक्कत है, आप जल्दी जाके echo करवाओ. Right? This is what you say. But if you know that this patient is anemic, this patient is athlete, this lady is pregnant, then you don't need to worry, this is a physiological sound. Clear? Now coming to the areas of auscultation. I will present you with some videos. Listen carefully where to auscultate the heart, very important. Anybody knows? What are the areas of auscultation of heart sounds? Raise your hand.
We have 4 areas. S1 is heard in tricuspid area and mitral area.
Which
that
area?
is at
Anatomical position.
Yes. In the left fifth intercostal space in mid-clavicular line is mitral area. And in left fifth intercostal space, just beside the sternum is tricuspid area. And in left second intercostal space, just beside the sternum, 2 centimeter away from the sternal line is pulmonary area. And right second intercostal space, just beside the sternal border, 2 centimeter away from the sternal border is aortic area.
Very good. Clapping for her. Now please play this video. Now listen to this carefully. These are the sites of auscultation of the heart sounds. Click on this. No. Just click on this. One click. No? Right? Loud S1 is during the mitral stenosis when your mitral wall is doing insufficiency. Then we have the tricuspid stenosis. It is very rare condition. Then we have tachycardia, exercise, anemia, all physical activities. Soft S1 sound will be in obese people plus left ventricular dilatation and mitral and tricuspid regurgitation. This is the physiological and pathological aspects. Then S2 sound, loud. When it will be loud? When we have tachycardia. What can be reasons of tachycardia? That is different thing. Systemic hypertension. Whenever the patient has hypertension, we will be having loud heart sound, and particularly the S2 heart sound. Then we have pulmonary hypertension. That is due to increased pulmonary artery systolic pressure. What can be the causes? Congenital heart disease is the most common cause that we will be discussing today in detail. Plus congenital aortic stenosis, and soft S2 will be during the severe aortic stenosis with calcification of the wall and the aortic regurgitation when the leaflets are not able to open. Now coming to the S3 heart sound. This is the ventricular gallop. When the ventricle is filling fast and emptying fast. Means ventricle is doing extra effort. S3 occurs in healthy children, young adults, athlete, pregnancy, fever, hyperdynamic states, but usually signifies a heart under strain, as in the heart failure or mitral regurgitation. Some physicians describe a tic-tac rhythm. Now if I say how the S3, that is like, this will be the sound. Not exactly, pitch will be little bit loud. Then we have the, just before a true gallop arises, there will be coexisting gallops. And if the ventricle does not recover from this, it will shift to S4 heart sound. Then S4 sound, this is the atrial gallop. That was the ventricular, this is the atrial. Now you know when the atria is under stress means what? The ventricle has already surrendered. Then comes the turn of the atria. Now atria is also under stress, and now if you don't do something, patient will collapse. It will go into the cardiac arrest. And sound, I told you how it listens. Most typically it occurs in heart failure and represents a tired heart. The heart is now tired. It is trying to sustain itself, but if it does not, then it will collapse. Acute myocardial infarction that we discussed. This was the heart sound. I will try if we could retrieve it. Okay. So now we are shifting to a very important topic of congenital heart disease, CHD. What is congenital heart disease? First, by birth, defect by birth. Heart structural defect, any defect in the structure of the heart by birth. It can be adult congenital heart defect also or pediatric also. What is the CHD registry in our country? Now see the irony of the medical system. 1.55 lakh children are born with congenital heart defect every year. And 78,000 children die. And we people say medical science is advanced stage, very advanced. 78,000 children die due to inadequate healthcare facilities, costly treatment, and heterogenic mortality, the side effects of allopathy or surgical failures. 78,000 children are dying. 214 deaths every day and 9 deaths every hour. This is, I'm talking about small children. What are the types? They range from the simple to complex and the critical ones. Simple defects are 2, atrial defect and ventricular, that we call ASD and VSD. Then we have complex, which are hypoplastic left heart syndrome. What happens in this case? The left ventricle is not, yes? Yes, please. Hypoplastic. What does it mean, hypoplastic?
Most of time aorta arises from the
left ventricle is missing. Have you heard about it?
overriding of our
That is tetralogy of Fallot that you are saying. Hypoplastic left heart means by birth the left ventricle either is not formed or is very small in size. Now tell me, can homeopathy do anything in that case? The left ventricle is not formed. Can homeopathy help such small kids? Yes, practitioners?
Beta-carb has helped, plus syphilinum.
After birth?
After birth also, to some extent, the beta-carb and carbo-veg has brought about the better quality of life in the child.
Yes, but he is very right that beta-carb, syphilinum, these medicines do work in congenital defects. And syphilinum I will discuss in detail today. But remember the hypoplastic left syndrome, we cannot do anything. An organ which is not developed, how can you regenerate it? We are not He-Man or Superman or all these superheroes. Accept your limitations openly. This is also very important. What we people are, two types of homeopaths are there. One are super confident, one are underconfident. Balance is not there. So you should be open with your limitations, because see, allopathy has 1,000 times more limitations than homeopathy, and they do accept it. They simply say before the surgery of the patient, 2% chances are there you will survive, 98% chances you will die during the surgery. And homeopaths have the guts to say this? No, because we do believe that homeopathy can do anything on this planet. And remember, homeopaths cannot put scrambled eggs back into the shell. Nobody has given us authority to do that, right? Atrial septal defect, the simplest one, easiest one to cure. I am saying not treat. There is a difference between treat and cure. And this can be cured. We will see some cases also. Hole in the wall between the atria, which are two chambers of the heart. We all know what happens. The blood mixes together, right? This is the diagram. You can see the normal heart is on that side. And there is the atrial septal defect. Types of ASD are there. 3 types are there chiefly: sinus venosus, secundum, and primum. Which is the commonest one? Which one is the commonest one? Ostium secundum is the commonest one. The secundum, what we call OSASD. Now is the ventricular septal defects, hole in the ventricles. Again, there is the shunting of the blood. Now see, these defects account for 25% of congenital heart disease. Means after every 100 patients of CHD, 25 patients will be of ventricular septal defect. alone. This is the diagram of ventricular septal defect. You can see on the this picture, there is the hole in the lower chamber's wall, interventricular. These are the types: perimembranous, subarterial, infundibular, muscular, and atrioventricular canal. Which one is the commonest? The commonest and easiest one to treat. Just look at the diagram, you will understand it. Perimembranous, the first one. Why? Because septum is already there. Your medicines just need to trigger the growth. Now, what homeopathy can do in congenital heart defect? Anybody having experience, sir has shared? Anybody else? Anybody has seen, treated, learned, heard? Anybody? Ever? Yes, please give a.
ASD, sir. ASD I have treated because it was referred by one of the doctor at Bangalore. I am practicing in Davangere. So I just treated that child with the constitutional drug.
Right.
That was the calcarea carb. And the baby was 8 months old. And now that baby is doing 8.5 years. She's very fine. And she's from a doctor's family.
What was the size of the defect?
It's a point that exactly I don't remember. But very long back I've treated, like 16 years back. Now, at the age of 8.5 years, they have came to me again for recurrent cold cough. That time I just came. Now I think that girl is almost about 16, 17 years.
That's great.
Fine, sir. Thank you.
Now, what is the role of homeopathy? The blue is the scope and red is the limitation. Atrial septal defect, the simple defects that I told you can be treated, can be cured. Ventricular septal defects can be treated, can be cured. But hypoplastic left heart syndrome, tetralogy of Fallot, we cannot do anything in that case. In tetralogy of Fallot, we can simply treat the defect only. This is what we can do. But other than that, we cannot do anything. Right? Now see, what does it make a sense? Because suppose a patient comes to you and you don't know what you can do and what you cannot do, how will you deal with that patient? Either you will simply say, no, homeopathy mein to ye hota nahi hai. Second thing, you will say, yes, I will do it. And unfortunately, the patient will survive with your overconfidence. So be sure what you are doing is much required along with what you cannot do. Like in exam time, what you people do. What we need to study is important, but what we don't need to study is more important. ये तो आएगा नहीं exam में, होता है ऐसा? Right? The same thing in your practice. Yes, this I can do, okay, but this I cannot do with my medicines. That is also required. Now this is the viewpoint, what I feel an allopath believes and what being a homeopath I believe. An allopathic cardiologist believes that CHD, congenital heart defect, is completely a surgical disease. This is what they say to all patients. And in this case, we have a window period of 2 years. What does it mean? Because allopaths cannot do the surgery till the child attains 3 years of age. And the patient generally comes to you by the time when he is 6 months to 1 year of age. So you have 2 years to prove you can do something. In my practice, 70% of patients, they get date of the surgery after 2 years. That once your child becomes 2 years old, 2.5 years old, you just come and we will do the surgery. And I do prefer going for the curative echocardiography report. Once I completely cure, I advise them to go to the same surgeon so that he should defer the surgery with his own writing. Because that will tell him what homeopathy can do. Right? Don't fight with allopathic system. Just do your actions, cure the patients. Patients will go to them and they will tell that yes, this is a homeopathic doctor's result. Right? So I believe that CHD is a non-surgical disease in most of the cases. PAH, pulmonary arterial hypertension. This is the biggest challenge in congenital heart defect cases. And allopathy is a poor science in this because they don't have a medicine for this. What they give? Sildenafil citrate. The Viagra tablet is being recommended for PAH in small kids. And I have never seen this medicine working in a patient. And PAH can be reversed within 20 to 40 days as per my experience in 90% of cases with homeopathy. And only remedy I am telling you, laurocirrhosis. If you people have used or read about it, laurocirrhosis is a lone remedy in the materia medica which can reverse PAH within 1 month of the time frame. Then heart failure cannot be prevented, allopaths say. But we people can prevent impending heart failure. Even we have a rubric for that. Impending heart failure. The heart failure which is about to come, we can prevent it. Septal defects can be repaired surgically before the 5 years of age. This is allopathic doctor's quote. Septal defects can be repaired medically at any age of diagnosis. This is what I believe. Except palpitations and low BP. Sometimes the patients to come that allopaths say homeopathy के अंदर BP बढ़ाने के लिए to increase BP for hypotension and for palpitations. There is no drug in cardiology. This is what they believe. I believe that except bypass surgery and pacemaker implantation, allopaths don't have anything to treat cardiac disorders. Every medicine they are giving is a waste of time, plus inducing new and new symptoms, new and new diseases in the patient. A patient who starts taking the atenolol, this is the first drug in hypertensive patients. Ask any patient who started taking atenolol 10 years back, what he is taking today. In the last 10 years, he might have got 3 to 4 new remedies, new medicines, because every 2 years, the medicine has to be changed. And in homeopathy, 6-month, 8-month treatment can reverse hypertension. We don't need to give it the lifelong. So now just 1 or 2 cases I will share with the CHD. This is a case of atrial septal defect, ASD, plus the Down syndrome. Anybody knows, is there any relation of Down syndrome to ventricular or atrial septal defect? No, not sir, homeopathic in medical way, yeah. Down syndrome and septal defect. Any relation with two? Nobody knows? Yes? What is Down syndrome? Look at this child face. What do you see? Is this a normal face or what? Yes? So what happens in Down syndrome? Students? These are students? What happens in Down syndrome? I think this is the first or second year topic. Yes? Anomaly, right. So basically, this relates with the what? Yes, yes, please. Somebody spoke. Trisomy 21. Yes, very good. Clapping for him. So now if you go through the trisomy 21, that this defect means there is delayed growth during the intrauterine life. And this is the result that ASD and Down syndrome goes together. Around 70% of Down syndrome cases will be having the congenital heart defect. 70% I am saying. So this was 18-month-old kid, known case of atrial septal defect with Down syndrome reported with impending heart failure, with recurrent hospitalization, and was advised immediate surgical repair of the defect at PGI Chandigarh by the age of 3 years. Child is 18-month-old, 1.5 years. They gave him date for next 1.5 years after that, so that the child attains the age of 3 years, then they will repair the defect. This is the echo on 12th of April 2018, you can see there is 8 mm OST. OSAST, ostium secundum atrial septal defect. This is the report of PGI Chandigarh, the Premier Institute of North India. With left to right shunting and tiny PDA. What does it mean? It is normal? Abnormal. Because by the time of the birth, it should have closed. Right atrium, right ventricle dilated more than left atrium, left ventricle. What does it mean? The right chambers of the heart are more dilated. What does it mean? Left to right shunt. Then what? What is impending? Right-sided heart failure. Because on the right side of the heart, there is more pressure or more flow of the blood. So simply, see, this is how simple the medical practice is. Just by looking at the echo report, you can see what can happen to this patient in upcoming days. Just by seeing that, yes, this, because see, in these cases, you should make a plan of minimum 3 months. If plan A fails, what is the plan B? If B fails, what is the C? Plus, in these critical care cases, you should be always ready for complications, always. ऐसा नहीं है कि केस शुरू किया, in the middle of the game you say, no, 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 I will not do anything, go to the allopath. This is not a practice. Now this is the report, I am just taking it short. This is a huge load case, right? Echo report of 20 of September 2019. You can see what is the defect, 2 mm. The same hospital which called this child for the repair of the defect. This was the pre-operative echocardiography report. After this, within few weeks, there was a planned surgery. 2 mm OST, OSAST plus PFO is there. What is PFO here? Patent foramen oval. Anybody knows what it is? Previous report, what it was? PDA. Now it is PFO. Now see, let me tell you one thing. When you treat such patients, the echo doctor will be confused what happened to this patient. Because many times what I see, they write that something is doing like this in the echocardiography. That is what? When you start treating the patient, there is regeneration of the tissue. And that tissue for them is something very challenging to interpret. And this tissue will join together to completely close this hole. This is how the system works in these cases. Then we have tiny non-audible PDA. What does it mean, non-audible? What is non-audible PDA? What is the difference between the previous and now this report? PDA is there, but it is non-audible, means it is non-pathological. So this is completely reversed. Now, does this patient need further treatment? When to stop is also very important. In homeopathy, especially when you need to stop. Does this patient need treatment? Who said no? Yes, please. Yes, yes, you are right. Yes, please tell.
It's in recovery phase, no sir, we can wait and watch.
We don't need to wait, he is already cured. Why? Because defects up to 4 mm don't need treatment if they are asymptomatic. Remember this. Any defect in the atrial septal or ventricular septal up to 4 mm are not requiring any treatment until and unless they are symptomatic. And now this patient is asymptomatic, no murmurs are there, no abnormal heart sounds are there, no symptoms are there. So this patient immediately requires to be wave off from the treatment. This is the recovery, not only because homeopathy holistic system. Not only the defect was working in this case, see the changes in this child. Sir, this is case of Barretta carp. Syphilinum Barretta carp. March 2018 when he came to me, the first picture. Then December 2018, August 2019. Now it is 2023. He has started walking, talking, going to the preschool. Definitely his life will be at least 1 year behind other normal children. That I cannot do anything in that. But you see the transformation of this child. And now nobody can see this child and say that this is a Down syndrome baby. So this is the prescription for this case. Cifilinum 1M 1 dose was given to this patient. Why it was given, I will tell you in detail with scientific explanation. Digitalis 6C was given for impending heart failure and it was continued for 3 months of the time. Spongia 6. Now anybody tell me why Spongia is required in this case? This was a very important remedy for this case, Spongia. Respiratory. See, you are closer to the right answer. Spongia is the best remedy when you have lung symptoms due to the cardiac pathology. Right? Symptoms we all know. Spongia, dry cough, that is the cardiac cough. Beritacarb was the constitutional remedy for this patient. These medicines were not given all together, don't think so, because I have taken it in short. Beritacarb 30C was given intermittently, 30C, 200, 1M, and last dose after this echo report was 10M to completely stop the treatment. And in the meantime, all allopathic medicines were withdrawn. Now, this is the biggest challenge for homeopaths. What medicines should continue? What medicines should stop? Because an average cardiologic patient in allopathy takes 8 to 12 medicines, minimum. And I have seen some homeopathic colleagues of mine or students who say, isko band kar do aap. You shift to my treatment, and the second day the patient is in hospital. You should be very careful in withdrawing the allopathic medicines, especially in cardiology patient. Very important. And aspirin. You know what is aspirin? The blood thinner. Homeopathy does not have any alternate to aspirin till now. This is what I feel. Because I don't talk about materia medica only, I talk about evidence that whether our medicines can do something with the INR ratio or not. Right? When it can alter the INR ratio, then I will believe that my Crotalus horridus, my Arnica, my Bothrops, these medicines are equal to aspirin. But till now we have seen reports of many patients, there are no changes in that. So I never stop aspirin of a heart patient, never, not at all. Rest all medicines can be tapered down slowly and ultimately can be stopped. In this patient, he was simply on the diuretics. Diuretic which mean, what is the role of diuretics? Yes? आपको ही बोलना पड़ेगा. No. Generally diuretics, what are the diuretics? To eliminate the fluid accumulation, right? In any case, like he told in the pulmonary edema or cardiac edema. So this patient, I stopped diuretics immediately. Why? Because my digitalis is far times better than the allopathic diuretics, far times, right? So this was one case. Now we have another case of ventricular septal defect. 6-month male baby was brought in our OPD with recent hospitalization due to pneumonia and was put on the ventilator spot for 26 days. And unfortunately, what happened? The doctors told him that if this baby goes on ventilator again, he will not survive. Now see the challenge to be taken. And in these cases, you have very small time to show the result. Few weeks, and sometimes few days also. It was a known case of ventricular septal defect. 2 defects were there, 5 mm and 4 mm. Now see, this patient defect was only 4 mm plus 5, but was very highly symptomatic. That's why he required treatment. And PASP, pulmonary arterial systolic pressure, is 56 mm of mercury. Who will tell what is the normal PASP? If any student of this BVVS college tells, I will request Dr. Arun to give him one leave. Right? Any student, if he can tell, what is the normal reading of PASP? Pulmonary arterial systolic pressure. 30. Dr. Majnunat Patil is very close. 25 is the normal. 25 to 30 is subclinical. It can be observed, but above 30 is critical. And this patient has 56. Left atrium, left ventricle were dilated with severe LV systolic dysfunction was there. Baby was unable to take feed. Marked sign of difficulty in respiration, whimpering, weeping sound. What is whimpering, weeping sound? The pathognomic sign of congenital heart defect. Pathognomic. What is pathognomic sign? Just by listening to it, you will be confirmed that this is CHT. How whimpering, weeping sound is there? Yes? How the normal baby cries? Anybody in pediatrics practice? Somebody was there, he went okay. How the normal babies cries? Any mothers who are having the infants? Nobody will tell you. Yes, how the normal baby cries, anybody can tell? Dr. Manju, you tell me. He invited me here, huh? So I am asking him. Give him a mic. Don't worry, I will show you.
Sir, I am very weak in mimicking, please.
No. You are married?
Yeah. Even I have 1 year child.
Then you can tell me. How your baby used to cry?
No, his cry make me irritated. Now if I cry, then all people will get irritated. So I don't want to.
Okay.
Yes, actually, like.
Done. So let me tell you what is the whimpering, weeping sound. Have you heard this sound? This is whimpering. And just by listening to this sound, you can be 90% sure there is something wrong in the heart of this kid. This is how the beautiful medical science is. But we people don't know these things. This is whimpering, weeping sound and pathognomic sign of CHT. Okay, so the extent of disease was just clear with this whimpering sound, that how difficult this kid is able to weep. And imagine when he takes the feed of the mother, what will happen to this kid? Clear? So allopathic cardiologist advised the immediate surgical intervention to get the defect so as to avoid any complications, because if this child goes to ventilator the next time, he will not survive. This is what the allopathic cardiologist was saying. This is the history of the patient. NICU, 6 Feb 2013, was kept on ventilator support for 26 days. To severe pneumonia was there, endocarditis was there, raised pulmonary arterial systolic pressure, signs of impending heart failure, referred to PGH Chandigarh for 28 days. Now the hospital which treated this kid for 28 days ventilator support, they refused to do the surgery. Because this was a case which was having severe complications. Physical examination, pansystolic murmur, grading 4/6. This is how we grade the murmurs. Right? With bilateral basal crepitation in the lungs, heart rate was 156 beat per minute. This is normal heart rate. 8 month kid. 156. Yes? Heart rate is normal or not? What is the normal heart rate in an infant? 122. Right. Respiration rate is 52. This is also tachypnea, increased. No signs of icterius cyanosis, edema. Spleen is enlarged. What does it indicate? Splenomegaly in cardiac patient. What does it mean? Portal hypertension, clear, right? So portal hypertension will always give you hepatosplenomegaly, and that is a sign of severe complication. And in this small kid is a matter of concern. This is the before treatment echo report you can see on 2018, 5th of March. Two muscular defects. One is 5 mm, second is 4 mm with left to right shunting of the blood plus PASP 56 mm of mercury. This is the first report before treatment. And now see, I was not taking this case initially because you see very challenging, and in case anything happens, the credit will go to me. This is the irony of medical science. The last doctor is the culprit. And last are the homeopaths, right? So I refused in the first instance, but they told that they don't have any other hope. And then by taking the written consent, and now this is also very important medical legal part I am sharing with you, that in these cases always take medical legal consent of the patient. That everything has been explained to the patient in detail. Still they want to go for the medical management. So in this case, I refused, but now this patient was being started with the treatment. 25 days after the treatment. Now see the report. 40 mm came down, 56 to 40. VST came down to 3 mm and 2 mm. Just after 25 days of the treatment. And fortunately, we could save surgery in this patient, plus there was no hospitalization required. After 4 months of treatment, pressure came down to 37 and defects were 2 mm and 1 mm. Now this patient requires only some treatment to clear his pulmonary arterial hypertension. Defects are almost closed. And I still remember this cardiologist talked to me on phone that I can see something traveling in the heart like this in the echo report. What it is? Because when you do treatment of these patients, you will see the recovery of the septum in the echo visibly, if you can interpret it. And unfortunately, after that, they joined together, forming a wall. What were the doses? Syphilinum 200, one dose was given before the start of the treatment. Antimonium Rs was given to this patient. Lorocirrhosis 30, because any case of pulmonary arterial hypertension, we give lorocirrhosis. Why we give it, I will tell you in the later slide. Enalapril 2.5, this is the ACE inhibitor in allopathy. That was tapered to once a day and then it was stopped. Hundreds of cases of CHT have been treated till now. I could just share 2 cases here. This is another case of VST. You can see 8 mm was there. In again Down syndrome baby. That came to 5 mm. This is adult atrial septal defect case. The defect was 25 to 26 mm, around 2.5 centimeter. That came down to 14 mm. And this lady could not conceive due to this defect. And by the time it came to 14 mm, she could deliver a normal baby. Now what is the role of syphilinum in congenital heart defect? Dr. Manj, we have only 45 minutes. I already started late. I traveled here for, I think, 2,000 kilometers. So please, at least 2 hours should be completed. Right? CST and syphilinum, what is the connection? This is the research paper which tells you that there is a mesodermal expression of MOZ, gene in the necessary which is developing the cardiac septum. Without this gene, look at this, MOZ gene, TBX1 factor, if it is not there, there will be no mesodermal development in the baby. Right? This is the scientific allopathic doctors' research paper, not homeopathic doctors. Now what happens in the patients of CHT? When there is the deletion of TBX1, due to any mutation, due to any intrauterine complications, and the most common cause of the congenital heart defect is when the mother consumes alcohol during pregnancy. 90% cases I have seen history of consumption of alcohol during pregnancy, plus maximum cases are of mental stress. So due to this gene weak expression, there will be the malformation of mesodermal layer of the heart, which leads to the VST. And now comes the syphilitic miasm and syphilinum. This is the master of syphilitic miasm, this medicine, we all know this. Now, the structural manifestations, all dices. Wherever you have D-Y-S, there comes the syphilitic miasm. Dysplasia, dystrophy, dysmenorrhea, dysphagia, all are syphilitic. Affection of the mesodermal region, that is to the bones, cartilage, joints, lymph, blood, and the heart. So this remedy has the mesodermal expression seat of action. According to Master Hahnemann, the syphilitic diathesis can be traced back to the antecedent of the syphilis, resulting in congenital deformities. This is what Dr. Hahnemann says. So now, if you correlate the two, it is clear that syphilis is the cause behind congenital heart defect, because the TBX1 factor, mesodermal expression, all correlate. And the syphilinum is the medicine where we have the genetic aberration or resulting of the functional or physiological misalignment. The syphilinum is a very well recommended dose. And I have seen in 99% of cases, this medicine works in the cases of CHD, 99% of cases. Only single dose. So this was about the syphilinum. Now comes the lorocirrhosis. Lorocirrhosis has 3 active components in the medicine. Which one? One is the amygdalin, that is vitamin B17, what we call. One is prunasin, that is the hydrocyanic acid. And third is the phytosterol compound, which is the similar compound to the cholesterol molecule. Now, what are these functions? First is the cyanogenic glycoside amygdalin. It is acting as a diuretic, calcium channel blocker, plus myocardial strengthening of the tissue. In fact, indications are CHF, HTN, and pulmonary arterial hypertension. The second component is prunasin, that is the hydrocyanic acid, which contains cyanide. It is a poison. It helps in increasing the oxygen affinity towards the tissues and organs and helps in the cyanotic diseases, pneumonia, PAH, CHD. Then phytosterol compound is similar to the cholesterol. That's why it acts as the statin. Statin is what? To lower down the lipids. The Materia Medica says difficulty in combating the breathing, suffocation, tightness of the chest, increases the efficiency of the walls of the heart, helpful in treatment of the heart murmurs, tones the heart musculature, relieves the backlog of the blood in the lungs, impending heart failure, what I told, pulmonary edema. So all these things can be recovered with the lorocirrhosis. Bluish cyanotic due to relative lack of oxygenation, the shunting of the blood. Chest muscles become weak, and particularly the expiratory muscles. This red line clinical indication, it helps breathing in, though breathing out is difficult. Just by listening to the breathing sounds of the patient, you can tell whether this patient requires lorocirrhosis or not. Breathing out, expiration is difficult. So that was all about the cardiology. Now I will be talking about the oncology. Any doubts in this? You can ask in 5 minutes.
Sir, limitations of homeopathy in cardiology. Limitations.
Limitation I told you. One is the pacemaker implantation. We don't have anything to do for that. When the patient requires coronary artery bypass grafting, we don't have anything for that. Plus, if the patient is in cardiac arrest, we don't have the invasive techniques. Otherwise, we have medicines, but we don't have the invasive techniques. This is what the limitation we have. Yes?
हेलो सर, आपने जो केसेस प्रेजेंट किया वो असाइनोटिक हार्ट डिसीज वाला था.
यस,
असाइनोटिक वाले थे. अगर साइनोटिक डिसीज रहेगा तो कैसा अप्रोच रहेगा?
अगर
साइनोटिक हार्ट डिसीज रहेगा
हाँ,
तो कैसा अप्रोच रहेगा?
cyanotic medicines will change.
हाँ,
Approach will be same.
अप्रोच विल बी सेम.
Yes, yes, yes.
हाँ,
Medicines will change.
वही पूछ.
Yeah. Because when we have cyanotic, there will be cyanosis, so all medicines which cover cyanosis, that will recover. But laurocirrhosis will remain there.
For the cyanosis and
See,
cyanosis.
two medicines, syphilinum for the miasmatic analysis, and laurocirrhosis, if there is pulmonary arterial hypertension, they will remain. Right? Yes?
Treatment for cardiomegaly and cardiomyopathy.
Cardiomegaly?
Cardiomyopathy.
Yes. Medicines. There are many medicines. If I name few, Crataegus, Terminalia, Arjuna. Then we have this, what we call, Strophanthus ispidus. Then we have Spongia tosta, again in that, laurocirrhosis also. Any medicine which works on the myocardial tissue, that will work. See, in cardiac practice, if you are giving pathological prescriptions, your selection of medicine should be on the basis of seat of action of the remedy. Right? Okay. Down syndrome we cannot cure. Am I right? Down syndrome cannot be cured like diabetes. See, cure and treat, these are two things. The day we can reverse the mutations, we will be able to deal with cancer. Right? Equivalent to? Yes. Arnica and amyl nitrosum. These are the two medicines which take only 30 seconds to relieve chest pain in cardiac patient. Sorbitrate takes 90 seconds. Yes? Latrodactys also, but if we compare with particularly sorbitrate. So I will directly shift to the clinical part. Now, what is cancer? We all know. What is cancer? Yes? Uncontrolled multiplication of cells. Good. Now, patients will come to you and will tell you that I was completely fine. Immediately, I have a swollen lymph node here. I don't drink, I don't smoke, I don't eat non-vegetarian, I don't take alcohol, I don't have a family history of cancer, then why this happened to me? Suddenly there is lymph node. What happens to someone that a person living a normal life suddenly gets a tumor, swollen lymph node, or raised blood counts that we call the leukemia? So cancer is a series of molecular events. Always remember the things which are working behind it is not at the cellular, but beyond that. Up to the genetics that we'll talk, mutations. Fundamentally, which alters the normal properties of the cells, the normal control systems that prevent cell overgrowth and the invasion of other tissues are disabled. In cancer cells, the normal control system prevents cell overgrowth and invasion to the tissues are disabled. Now see, in short, I will tell you that in our system, internally, the nature has designed a system that if any cell is not properly formed, it will lead to apoptosis. Either it will be repaired by the DNA repair gene, or it will lead to apoptosis. That is what we call the programmed cell death. And when these two phenomena stop working in anybody due to the genetic mutation, this is what cancer occurs. Simple formula is this. And why it occurs? Because of the carcinogenesis, carcinogens. Why it happens? The mutations in the protein encoding genes, what we see, that regulate the cell division, either the DNA repair genes or the genes which help in the apoptosis. Now a question that everyone having the family history gets cancer. Why? If somebody has a cancer patient in the family, is it 100% sure that he will also get cancer? Why? Yes? Lifestyle, okay. Predisposing factor, right? Yes?
We need not need a particular family history for it.
You are 40% correct. Everybody does not have oncogenes. Oncogenes means what? Which are coming from the family. There are two things, remember this. One is the germ cell line and second is the somatic cell line. Germ cell line comes from where? From the family, paternal, right? That is 50% of the cancer. Suppose a patient is there, his mother was a cancer patient. That means what? That 50% of genes are already into that patient. Now remaining 50% depends upon the lifestyle of that patient. Whether that trigger is induced, then what happens after the trigger? The somatic cell line also gets mutation and now this patient is 100%, then comes the cancer, right? So I will skip all these things. So not everyone with family history of cancer gets cancer in their lifetime. Only those people who get the mutations due to their somatic cell line mutations. That is the recessive one. Now cancer psychodynamics. The cancer state of mind as per homeopathy is resigned state of mind. 75% of breast cancer patients have mental trauma. 75% of breast cancer. That does not mean everybody will be cured by ignition and Netromue. Let me clear it, right? Because this is a misconception in our system that 20 polycrest can do wonders. We have 5,600 remedies as of now, if I am not wrong. 5,600 remedies in materia medica. If practice was with 420 polycrest, the things would have been different. Either from having given up from the stress or disappointments in life, that's why this is the carcinosinum state of mind. Given up, right? Weakness of the will to counteract the situations and just accept what others have dictated for them. Now this is important. There was a research in the medical ward where the nurses calculated that the patients who were more outbursted, who angered with them, who abused them verbally, those patients survived better. Means what? Outpouring of the emotions is very much important in the cancer patients. And the people who were sweet, polite personalities, they usually had the poor prognosis. This is the research into the oncology ward. The unlived life, this sense of desire function left fallow and undeveloped. I wanted to do this, but I had huge pressure of my parents. I could not do this. Carcinosinum state of mind. Now, as per Dr. Henneman, we have two stages of the cancer correlating with the organon. Preclinical phase, which extends from the inception of the cancer to the time that it produces recognizable signs and symptoms. Now, what is the inception here? Inception is the miasm. Down from your family history. Predisposition, disposition, diathesis, then comes the disease. Clinical phase, the phase where the disease expresses itself overtly through the sign and symptom, which can be seen in radiological reports, which can be clinically examined. That is the clinical phase. Now, as per the PET-CT report, we can find 0.8 mm. It is written 0.6. It is actually 0.8. 0.8 mm of tumor can be detected in the PET-CT report. And that contains 108 to 109 cancer cells. So this is just the start of the cancer. And clinical phase, here allopathic system fails. Because what they believe, that this is the disease, the superficial layer of the cancer tumor. But they don't know this is the tip of the iceberg. As per the latest research of cytogenetics in cancer, it has been assumed that it takes around 2 to 20 years to a patient to get cancer in his lifetime. It can be between 2 to 20 years. It is not an overnight disease. Right? And in small kids who have the early childhood cancer, that comes from the history, from the family history and during the intrauterine life. This is the conventional cancer treatment. We all know chemotherapy, radiation therapy, surgery. 1,300 people die of side effects, die of the cancer every day in our country, and around 400 patients die of side effects of chemotherapy. So almost 40% patients are dying due to the side effects. And still we say this is the definite treatment. Homeopathic treatment can be for the curative purposes. Disease which is chronic in nature, gradual progression is there, subtle onset is there, unsatisfactory resistance of the vital force. Now, when we have the unsatisfactory resistance of the vital force, this is what Dr. Henneman has written, that when you have unsatisfactory resistance, the disease will come out. Right? Do you think giving constitutional treatment in stage 4 patients will work? Yes? When the vital force is already almost dead. Almost dead. Do we have anything that immediately we put a one drop on the tongue of the patient and patient, yes, I am alive? Any Sanjeevani booty in homeopathy? Yes, this is what you need to understand. You need to change your approach of the treatment time to time. Otherwise, your patients will suffer. Stage 1 patient, stage 2 patient work wonderfully with constitutional approach. But when the stage 4 patient who has already taken chemotherapy, surgery, radiation, the vital force is where? Right? Step 1 treatment, what I do feel should be done in these cases when there is a high tumor load, means a big tumor is there. Cell-targeted medicines in homeopathy are there which have been well proven in vitro studies and now in vivo studies also that they can be a good targeted drug given in the lowest dilutions. Treatment must be first to be targeted at the specific organ or tissue, then the cancer tumor. I will just share 1 or 2 remedies to understand the concept that how I am saying these are the targeted medicines when given in lowest dilutions. Semper Vivum Tectorum. This medicine contains 5D, 5-methyl pyrorin N oxide. This is the active component of this medicine. It acts as an antioxidant, helps decreasing the free radical activity in liposomal system, leading to the tumor lysis and growth inhibition in the cases of C8 tongue. This is the research. You can just Google it, you will see how these things work. We have Hydrastis scan. We all use it for the cases of cancer, but how it works? There is a component berberin. It is present in Hydrastis, and second remedy is the Berberis vulgaris. It can stimulate G2 cell proliferation, cycle arrest in hepatocellular carcinoma. It was determined by the downregulation of HNF4 alpha. That is hepatic nuclear factor 4 alpha, and it can induce apoptosis in the pit of the hepatocellular carcinoma. There is another medicine, Scrofularia nodosa. It suppresses the regulation of BCL2, that is the cancer gene. Second is step 2, the specific drugs. Specific drugs means what? When the patient's tumor load is low, the tumor has shrinked with the tumor lysis, you can shift to the specific. Specific means depending upon the family history or the past history of the patient. 2 remedies come to your mind when you talk about anything about the cancer and the miasmatic evaluation of the cancer patient. One is the carcinosinum, second is the scarinum. Carcinosin is the drug when we have the family history of cancer. Dr. Burnett has written that I have used it for many cases where there was a sure shot of family history of cancer. And Dr. Clark has also used in CA cases. Scarinum is the remedy when you don't get the response from carcinosinum or you don't have the family history of cancer. Then scarinum is the drug of choice. And Dr. Blackie, he was a US physician, he used in the cases of CA breast, lungs and the liver. Constitutional approach, I already told you. My experience says that in cases of Stage 1 and 2, this is a boon to the patient. But in cases of stage 3 and stage 4, you need something more aggressive in your treatment. When the tumor is eradicated partially or completely, and the patient's vital force is now standing there to compete, then only you can think of the careful constitutional prescribing. Now 1 or 2 cases, then we will complete. Stage 3 relapse CA tongue case. This patient was a case of 57 years old male with CA tongue who had 6 cycles of chemotherapy with 36 radiation rounds, and after 23 days of completion of the allopathic treatment, there was a relapse with lymph node metastasis, and intent of the treatment was curative. Why? Because treatment can be regressed here. The tumor can be regressed here. It is still in the stage 1 or 2. This is the PET-CT report. Irregular lesion 3.9, 3.7, 1.7 centimeter on the anterolateral margin, which is extending to the sublingual space. Lymph node involvement was not sure, as per the radiologist. But we considered it as the lymphatic metastasis. This is the PET-CT report and the tongue lesion you can see all together before the treatment. The area which is illuminated in the PET-CT, you can see there is the primary lesion. Plus here we have the serous formation of the nodule. This is after treatment. Only 3 months of the treatment was given to this patient, and after 3 months you can see there is complete resolution of the tumor in the PET-CT report. Plus here only inflammation is there, but the tumor has subsided. Now, what treatment was given to this patient? Gallium apirine. Have you heard of this remedy? Gallium apirine and sempervivum tectorum. These 2 medicines can cover 60% of cases of CA tongue. 60% I am saying, on the pathological basis. Cysta scan was given, and after 3 months, only the residual tumor was observed. And then I gave this patient skirinum 1M, closed the case. And this is, I think, 4 years almost. Till date, there is no reoccurrence. Always remember, homeopathic treatment, if works in a cancer patient, there is 0% chance of relapse. 0% I am saying. Because till now, the patients whom I have cured in cancer, not even a single patient came to me back that now my cancer is back. And in allopathy, 80 to 90% chances are of reoccurrence. Another case is there, DLBCL, diffuse large B-cell lymphoma. 65 years old male patient of a school principal. This was a case of one of homeopathic doctor's father. He was diagnosed 2 years back with DLBCL and was given 6 cycles of R-CHOP. R-CHOP is the chemotherapy regimen, followed by 25 radiations with relapse within 2 weeks of the treatment. And now this was going on in the AIMS, New Delhi. Then they did RDGP chemotherapy. This is another protocol in allopathic system, which was given for 6 cycles, and it completed in April 2018. And now this cancer again came back with the partial response of the treatment. Looking at the partial remission and metabolic active disease, he was advised bone marrow transplantation by the AIMS. This is the PET-CT report. Before treatment, axillary lymph nodes are enlarged, multiple lymph nodes, mesenteric, left common iliac, left internal and external iliac, bilateral and inguinal. Intramuscular plane of gluteus muscle was having a huge tumor, 8.3 into 4.9 centimeter. This was indicative of recurrent disease, means reoccurrence of the disease. This is the PET-CT print report that I already mentioned. Prescription to this case was carcinosinum 1M stat was given with skirinum 200 every fortnight, plus conium maculatum 200 because it was a solid tumor. And remember, any case of reoccurrence of any bone marrow metastatic disease, conium is the first selection of the remedy. And this patient, after the treatment, this is the report after treatment. Complete metabolic resolution of the left axillary lymph node, complete metabolic resolution of the abdominal lymph nodes, and paraspinal mass, which was 8 centimeter, it came down to 4.4 centimeter. As per the AIMS report, it is complete remission, near to complete remission. And the bone marrow transplant was referred in this patient. Another case, a case of squamous cell carcinoma, skin cancer in 85 years old patient. What happened in this case? They refused to go for any treatment due to the age. And moreover, this was a cardiac patient. And she told me that I don't want to go to an allopathic doctor now, because she was very much, you can say, disappointed with the statement. And within 3 to 6 months of the treatment, this patient is completely cured. You can see complete resolution of the tumor. This is a case of adenocarcinoma of the prostate. This was stage 4 patient with metastasis to the bones, skeletal metastasis. The PSA was the monitoring. In this case, you can see PSA previously was, I think 11 or 10 point something was there, and after that it was, can you see on this? 10 point, and second report? 0 point something. So this patient is also, and this was a case of Ayurvedic doctor, BVVS doctor. Now, if we have time, can I take 5-10 minutes? Yes. Life is pleasant, death is peaceful. But it is a transition from life to death, which is painful, and the cancer patients are suffering from this. Particularly in India, we are seeing the palliative care is very poor, very, very poor. Once they feel their treatment cannot work, what they do? Take this patient home and do whatever you can do for the patient. This is the Dame Saunders. He has written beautiful stanza. He says, you matter because of who you are. You matter to the last moment of your life, and will do all we can. Not only to help you die peacefully, but also to live until you die. Who will take care of the patients who are about to die? Nobody takes care. Nowadays, in big hospitals like AIMS, PGI, they have palliative care centers, but otherwise the private doctors, they simply say that go, take the patient. And homeopathy, let me tell you, 1,000 times better in palliative care than allopathic system, 1,000 times. What is terminal care? It contains two main things. One is the hospice care and one is the palliative care. Palliative care is the symptomatic management of the chronic or limiting diseases, and hospice care is the comfort care at the end of life, what we call end of life care, EOL. Now I will just share one case, then we will complete of palliative care. This was a stage 4 patient, 74 years old female patient of CA right breast, which was inductal carcinoma, biopsy proven, lymph nodal metastasis for last 3 years on some homeopathic and Ayurvedic doctors' medicines with no relief and no report was being done. Monitoring of patient is very much required. Not only the clinical monitoring, but the radiological and lab investigations. So on examination, there was palpable cervical lymph nodes, axillary lymph nodes with basal clefts in the lung, which was indicative of lung metastasis. Plus, the patient was having advised the PET CT. PET scan revealed progressive CA right breast with metastasis to left breast, to the left lung, bilateral hilar lymph node, axillary lymph node, cervical, and the cervical spine. So there is the disseminated metastasis in this patient. CEA, this is the marker for cancer, 37. Normal reading is CEA up to 3. This is 37. CA 15.3 is 133. Normal reading is up to 15. Prognosis was poor and was explained to the patient attendants that we will do just the palliative care of the patient, and the expected survival was 6 to 8 months with or without treatment. You can see how challenging was this thing. And this is due to negligence of previous doctors. They did not go for any investigation in 3 years' time. Even we started with the palliative care, still she got the comfort. This is the pre-treatment in 12th of November 2016. This is 2018, 8 August, comparatively much better. Means this patient survived for 21 months, who was expected to live for not more than 6 months. And what occurred to this patient on the last day? These were all medicines which were being used in the 18 months duration. 21 months duration. Skirinum was given, Chimefila was given for the palliative care of the breast, Sanguinaria was given for the hemorrhagic lesion time to time, not all together. Antium Ars was given when she had pleural effusion. Echinacea was given for the cleaning of the wound. Califos was given for sinus tachyarrhythmia. This is a very challenging task. In breast cancer patient, there occurs tachyarrhythmias. Very commonly it occurs. Califos is a good remedy for that. In 3x trituration, arsenicum album was the last medicine which was given to this patient just few hours before her death. Because I generally don't give arsenicum album to any cancer patient. I don't know why, but it has been written in multiple literature that it is euthanasia of homeopathy for cancer patients. Amyl nitrosum was given inhalation for the pains whenever required. Can we play this video or no? No, this one left. No? Okay. So this was a video just few hours before the death of the patient. You will be able to see that how comfortably she died. Definitely, here is the limitation. We cannot put the scrambled egg back into the shell. But in palliative care, what we can do? We can let someone die peacefully. The person who survived 78 years with grace. Why medical science leaves such patients in the last moment? So homeopathy has the best options to provide good quality of life care, plus no hospitalization. This is the biggest thing. Because everybody wants that his mother, his father, his brother, sister should die at home. Definitely this is not an easy task to accept and not an easy task to tell to the family. But still, this is the right of the patient to get life of comfort at the dying moment. So next morning, this patient, this is a message, his son messaged me that my mother died peacefully early morning. She was very comfortable. I could see she was taking bread and milk while talking to the family just few hours before, and this is stage 4 cancer patient without any pain, without any allopathic medical intervention. So that was all for today. Thank you for inviting me. Thank you for giving this opportunity. Any doubts you can ask in next 5 minutes.
Friends, before I say any word, I would like to bring greetings from KQHD Association, Karnataka Qualified Homeopathic Doctors Association, which is running for the last 30 years in and around Bangalore. Only its aim is science, seminars, meetings, and nothing else. And the president of that association is sitting amongst you. Dr. SHATABDHI ji, can you stand up? He is the parents and all that taking videos of the medicines what he was giving. Always remember one thing. With my experience of 50 years in medical practice, I am talking. What cases he treats with his medicines for the patient he gets, he is the right one. Don't think that I will apply same thing in my patients which will not work. This is not allopathy. This is an individualistic medicine. You may get something else, other medicine. His motivation and inspiration should make you to read more and more the materia medica drug. Suppose you take up cardiology, read cardiology drugs completely and try to understand as he has understood each drug and prescribes. So that should be your aim. Doctor साहब क्या दवाई दिया बोलो? Never ask that. कैसे आपने treat किया? What are the symptoms you took? That is what is more important. This is what I want to say to all the students. Okay? Number one. Number two. More than curing, most of us are doctors. What I feel, what I've seen in most of the conference and all that, you present the case, you give the medicine, it gets cured, everything is fine, sab tali baja liya. But are we doing as a doctors, are we educating our patients to prevent cancer, to prevent heart attacks? Are we doing that? Forget about it, the patients. Are we doing for ourselves? How many of us eat pizza every day? How many of us drink alcohol? How many of us eat junk food? How many of us eat standing? All these things are the causes for so many diseases of heart as well as cancer. 60% of the diseases can be prevented provided you have a normal, healthy lifestyle as per the Indian way, not as the English way. Hello, hi, khake, standing you should never eat. Annam Parabrahma Swarupam. This is what is written as. It is Parabrahma, because of which you are living. Jatharagni, you are satisfying the fire in this farm. Not standing. Sit down and eat. Eat peacefully. Never drink water by standing. Sit down and drink. All these small, small things are we telling? How many chocolates we eat? How many of you know chocolates contain cockroach? Anybody? Raise the hand. How many of you know chocolates contain cockroach? Just open the YouTube. Check it up. Happy birthday. Most of the people who are spoiling the children are tatas and ajis. They go and give chocolate to the grandchildren, happy birthday. And you are giving a poison to them. Indian food is healthy food. Why we are able to fight COVID very strongly in India? Why it didn't affect? Because of our way of food, our lifestyle, our thinking. Your chutney, what you make chutney, sambar, they are very good for colon cancer. How many of you know this? Gobi manchuri. Do you know what do you know what gobi manchuri is? Have you ever eaten gobi manchuri? Tell me, who has eaten gobi manchuri? Everyone? No. You have, if you eat really gobi manchuri, once original, you put in the mouth, you will never touch any Chinese food. We eat gobi manchuri made with Indian spices. You have masala and all that, then you eat it. You go to Chinese restaurant and ask them to give pure Chinese food. You cannot even see it and you cannot eat it. We don't need those food. We need India. You see how many people eat pani puri? And imagine you'll get all the problems, including your menses problem, dysmenorrhea. One of the reasons is pani puri. How many of us know this? Are we educating our people? Are we educating our students? Are we educating our patients? Fighting, loving. See, he was talking about cancer. Cancer symbol is crab. You know crab mentality? Crab mentality is, naan gelliladre avun gelbardu. This, let us live. He was telling in the morning, Mahesh, you live, let others also live. Let us help others to live better. If you have these attitudes, your cancer will be minimum. I don't say you will not get it, you will get it, but minimum. And the heart disease will be much less. How many of you don't do yoga? I also don't do yoga. You don't do yoga? How many of us you don't do yoga? None of you don't do yoga. I know that. Sir, aerobics helikodi sir. Higi anodi helikodi sir. Aerobics. Why do you need that in India? Let me tell you, I am 74 years. I have no diabetes. I have no BP. I do Shirsasan right now here. It is only because I live healthy life, get up early morning, 3 o'clock, 3 a.m., sleep at 10 a.m., 10 p.m. No problem. And Brahmaji is there for seeing me for the last 37 years. See? Let us maintain Indian way of lifestyle. Never shake hand. Do namaste. Nothing wrong. I am wearing suit because our Dr. Arun Howley told me, you are chairman, don't come in dhoti, come in suit. Otherwise, people will not respect you. So let us live Indian style. Let us be healthy. Let us have healthy diet. Please encourage eating Indian diet, not pizza, burger. Can you tell me chalk cake? You do happy birthday cake cut pertiralla. Cake is made 3 days before, and you put candle on that, and then and then cut it and give it to others. Is it healthy? Just think all these things. Whenever you do. Cake cutting has come only for last 30, 40 years. Before that, you do respect, take blessings from the parents, go to temple, give a party. I'm not saying don't enjoy. Achha, can anybody tell me correct word for party in Kannada? I will give you 2,000 rupees right now, party. Huh? You know? There is no concept of party in India, in Indian language. There is no concept. Parivara milana. That's a different issue. Party means what? Eating non-veg food, drinking alcohol, and discussing non-vegetarian jokes. You tell me anything is better than that. Does anything better you have do it? ಏನು ಚೆನ್ನಾಗಿದ್ದೀರಾ ನಿಮ್ಮ ಅಮ್ಮ ಅಪ್ಪ ಚೆನ್ನಾಗಿದ್ದೀರಾ ಮಕ್ಕಳ ಚೆನ್ನಾಗಿದ್ದೀರಾ ನೋಡ ಏನಲ್ಲ ಹಿಂಗೆ ಮಾಡ್ತಾ ಇದೆಯಾ ಏನು ಇದು all these things you do in party. And is this the healthy way of life? Please take care of yourself and your health. Practice homeopathy. Read the drugs, as he said, completely, and don't imitate anybody. Create your own methodology. Thank you.
Please hand over the memento to our guest.
Thank you, sir.
Good evening to all. Dignitaries on the dais, Dr. Shripad Hegde, Member Consultative Committee, MARR, Rajiv Gandhi University of Health Sciences, Bangalore. Shri Mallikarjun S. Sasnoor, Chairman, Governing Council, BVVS Homeopathic Medical College and Hospital, Bagalkot. Dr. Arun V. Huli, Principal, BVVS Homeopathic Medical College and Hospital, and Organizing Chairman of GLOBULE BVVS National Homeopathy Conference 2023, senior homeopaths, heads and staff of homeopathic institutions, delegates, and everyone present here. It is an honor and great pleasure to welcome you all for the valedictory function of our 2 days BVVS National Homeopathic Conference. On behalf of the BVV Sangha's BVVS Homeopathic Medical College, Bagalkot, it gives me immense pleasure to welcome the chief guest of today's function, Dr. Shripad Hegde, a great teacher, a reputed homeopathic practitioner, author of valuable homeopathic books, man of great stature, of an oak, but humble as a sapling. Sir, from bottom of my heart, I thank you for gracing this occasion. I request Dr. Manjunath Patil, Assistant Professor, Department of Repertory, to welcome Dr. Shripad Hegde sir with a floral bouquet. Thank you, Dr. Manjunath. I feel very glad to welcome the guest of honor of this function, Dr. Santosh Yadhadi sir, former Deputy Registrar, Rajiv Gandhi University of Health Sciences, Bangalore, a man of highly considerate nature, prompt in providing his helping hand, and was a great support for us in the university affairs. Sir, I thank you wholeheartedly for making it to this function. I request Dr. Deepak Naik, Assistant Professor, Department of Forensic Medicine and Toxicology, to welcome Dr. Santosh Yadhadi sir with a floral bouquet. Thank you, Dr. Deepak. Thank you, Dr. Sunil. Thank you, Dr. Ramesh. With a humble heart, once again, I welcome all special invitees, guests, heads of institutions, delegates, and everyone present here.
I request to welcome with a floral bouquet. Talents and skills.
Principal, Dr. Arun Holi, Organizing Secretary, all the teaching faculty of BVVS Homeopathic Medical College, and all the delegates. First of all, I wholeheartedly congratulate the whole team of BVS Ayurvedic Medical College for their successful conduction of this 2 days national level conference. Congratulations, sir. Nowadays, we are seeing many of the conferences where the most of the students and the teaching staffs used to attend. But what the outcome from that conference is very much important. In academic, we need to attend the conferences, we need to present the papers, but here simply attending or presenting the paper is not the need of our. It is from this conference what all the things we took and we learned, that is most important. Because see, today's in these 2 days seminar, they have selected very good topic. They have done with a good theme, where around 5 to 6 speakers delivered their topics, seminar. And I was just seeing the last presentation from Dr. Bindra, where he has presented with many of the cancer cases. So really it is wonderful to see and to learn from such eminent physicians, because the students, the whole world is looking towards the integrated system of medicine, where the allopath is failing, our system is giving very good result. But the approach towards the disease is somewhat different. It is not like the allopath. So the concepts of this homeopath, you need to understand first. Without knowing the concepts, you can't treat. As sir was telling, like if you, whatever the treatment he has given in a case, the same treatment may not help in all such cases. The treatment protocol or the treatment or the medicines vary from one disease or the same disease in one person to another person. Because what we say, the prakriti of the person, it is very much important. We need to assess based on the symptoms. There are many criteria to assess. So we need to learn that first. Because once you diagnose the case properly, then you can adopt the treatment appropriately. So this is a time where we need to show the world what exactly our treatment is and how far we are better than other systems. Because there is a lack of awareness. Though we have very good the treatment in many of the chronic diseases, or it may be metabolic diseases or lifestyle diseases, we have very good treatment protocol. But we are failing to give awareness to the public. And even the lack of researches. The young minds always think towards the researches. So if you do the proper research and if you publish it, and everybody need of evidence-based science. See, once you do research and once you publish it, then only we can give some evidence-based studies or researches to the society. So my humble request to the students, whatever you have learned in these 2 days conference, you go and read it, because theoretical knowledge is also very much important. So if you have the proper theoretical knowledge, then you can adopt it in your clinical practice. And as in our Rajiv Gandhi University, we are providing the funds for researches for the undergraduate students as well as the teaching faculty. So you make use of the funds and you do some researches and publish the papers. So once we give awareness, once we give some evidences in the treatment, then definitely the whole society or the public look towards our system. So as since morning I am seeing many of the around I heard more than 1,000 delegates have been registered to these conferences, and all over from India, from different states they have come here, and really it is wonderful to see. And even the best thing is since 3 years I am seeing Dr. Arun Huli. He is very enthusiastic principal, and because always he used to think of good positive things, and even in within 4 to 5 years of this college, he has developed like anything. I can definitely say whatever the achievements of the development you are seeing in the BVVS Homeopathic Medical College, it is because of Dr. Arun Huli and his whole team. So I wholeheartedly once again congratulate Dr. Arun Huli sir and BAGALKOT sir, the organizing secretary, and whole team of BVVS Homeopathic Medical College, and I congratulate, and even I thank the organizers for giving me this opportunity. Thank you one and all.
Gentlemen, I, Dr. Prashant Chauhan, Professor and HOD in the Department of Community Medicine from BVVS Homeopathic Medical College. It's my privilege to introduce our eminent guest of honor for today's valedictory function, Dr. SHATABDHI sir. He has done his post-graduation in Ayurveda from DGM Ayurveda College, Gadag. He is the former associate professor from Government Ayurvedic Medical College, Bangalore, and he is a former deputy registrar medical and Ayush examiner.
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. Very good afternoon. Yeah, I know. Last 2 days, or yesterday and today, whole day and today, from morning to evening, you have heard a lot from the stage. That's why now you started talking. I can understand that. Naturally, everybody should get an opportunity to talk. And platform should be created. That is the human nature, and we are all not out of that. On stage, the seniors, Dr. ಶ್ರೀ ಮಲ್ಲಿಕಾರ್ಜುನ್ ಸಾಸ್ನೂರ್. ನಾನು ಡಾಕ್ಟರ್ ಅಂತ ಹೇಳಿಬಿಟ್ಟೆ, ಅದಕ್ಕೊಂದು ಅರ್ಥ ಇದೆ. ಯಾಕೆಂತಂದರೆ ಈಗ ನಿನ್ನೆಯಿಂದ ನಾನು ಇಲ್ಲಿ ನೋಡ್ತಾ ಇದ್ದೀನಿ, ಈ ಒಂದು ಪ್ರದೇಶ ಇದೆಯಲ್ಲ, ಬಾಗಲಕೋಟೆಯ ಈ ಗಂಡುಮೆಟ್ಟಿನ ನೆಲದಲ್ಲಿ ನಮ್ಗೆ ಎಲ್ಲಿ ನೋಡಿದ್ರೂ ವೈದ್ಯಕೀಯ ಕಾಲೇಜುಗಳೇ ಕಾಣುತ್ತೂ ಇಲ್ಲಿ ನಿನ್ನೆಯಿಂದ. ಹಾಗಾಗಿ ನಿಮ್ಮನ್ನು ನಾನು ಡಾಕ್ಟರ್ ಅಂತ ಸಂಬೋಧಿಸ್ಬಿಟ್ಟಿದ್ದೆ. ಅದು ಒಂದು ರೀತಿಯಾದಂಥ ಸಾಧನೆ. ಡಾಕ್ಟರ್ ಅಂದರೆ ಕೇವಲ ಔಷಧಿ ಕೊಟ್ಟವನು ಮಾತ್ರ ಡಾಕ್ಟರ್ ಆಗಲ್ಲ. ಸಾಸ್ನೂರವರು ಆ ಸಾಲಿಗೆ ಸೇರುವವರು, ಅದಕ್ಕಾಗಿ ಅದನ್ನ ಹೇಳಿದ್ದೀನಿ ನಾನು. ಇದು ತಪ್ಪು ಬಂದಿದ್ದಲ್ಲ, ಸತ್ಯವಾಗಿ ಹೇಳಿದ್ದು. ಆ್ಯಂಡ್ ಡಾಕ್ಟರ್ ಸಂತೋಷ್ ಅಡಳ್ಳಿ ಆ್ಯಂಡ್ ಅಶೋಕ್ ಕರಾಳಿ ಆ್ಯಂಡ್ ಹಿರೇಮಠ್, ಅರುಣ್ ವಿ Huli, the principal, and so many senior faculties are there. I don't like to take the names. Already everybody has struggled for more time. That's why let me utilize less time. And yesterday, since morning the session started, we heard 10% they practice classical homeopathy, 50% here and there, remaining 20% that and this, remaining 10% everything together. Yes, I agree. But still, my sincere and honest request is there, whatever it is, wherever you come under that category, please practice homeopathy. You take this message from this platform. Kindly follow the homeopathy. Whatever you are coming under that, 10% classical or 50% everything together, but prescribe homeopathy, I don't mind, because the homeopathy has found so many years back, then the situation was different. Now the situation is different. And this is a time one has to interrogate and see what is our role in the society. ಇದು ಆತ್ಮಾವಲೋಕನ ಮಾಡಿಕೊಳ್ಳುವಂಥ ಸಂದರ್ಭ. ಯಾಕೆ ನಾನು ಇದನ್ನು ಹೇಳ್ತಾ ಇದ್ದೀನಿ ಅಂತಂದರೆ, ಸಿ ಸರ್, ಅರುಣ್ ಹುಲಿಯವರೇ, ಇನ್ ದಿ ಸೇಮ್ ಕೇಸ್, ಇಫ್ the TV fellows have said that corona has already spread, I hope this 1,200, 1,300 delegates would have not come to BAGALKOT at all. See, this is a social injustice. And last 2.5 years, we have faced or we have failed to manage or face the COVID situations, irrespective of the system of medicine, I will tell you. It's a natural calamity, it came and went on. And everybody were taking the credit of that, we have done it, we have done it. No, not at all. That we have to think. In case, in future, if our lifestyle goes in this way, if we pollute the society, food, water, everything, what are the things we have to face it? As a social informer, working as a health volunteers, our important role is to convey the better message to the society that all the Panchabhutas should be kept clean, then only we can live more happy for longer life. And we can leave a best message to the next generation. Then, now Dr. Santosh Adhali has very specifically mentioned, I am very happy to say that research activities should be started or initiated from the second year onwards only. I hope that, I think we should concentrate a little more about that. Each and every institute, sometimes we see the board, the institute very big, the so-and-so Homeopathic College and Research Center. Research center is after that, there is no research at all. That should not happen actually, where unless and until we show the research in a different ways, society will not accept it. And ourselves we say that we have done a lot many things that may not be accepted very easily. For that purpose, all the statistics, data and everything should be collected. Each and every individual clinicians, when many practitioners are here, all you are doing the very good practice. You have so many data, but that has not been properly made it to present. Kindly make it. The clinical research publications, articles that can be made it. There is a provision in the Central Council of Research in Homeopathy. You just go through that. Or try to take help of somebody who could able to guide you. Try to bring the things more and more to the society that there are so many activities are happening that you should concentrate. That's more important. And in the institute also, the second year onwards only, you try to train them in such a way like that they could able to concentrate little about the research. Otherwise it may not have. It may be a pathological research. See, now I think Dr. Bindra, when he was presenting, he was telling the cancer cells happen, this and that, what changes we have seen after prescribing any medicine for PNR changes. Have any study has been made in that way? After prescribing your arnica, what happened to that? Any anti-hemorrhagic remedy after prescribing that, what happened to the PNR changes? Any such studies have taken place? If studies are there, certainly we could be able to tell to the society, no, these are all the remedies which will work better as compared to the aspirin or any such things. That is not happening at all. Then who cannot talk that? You got my point, what I am telling. See, such activities, such studies should happen only in the institutes that is possible. As an individual practitioner, it may be very difficult. And you have an advantage, Sasnur sir, I will tell you, because you have a so many other, what I can say, the co-institutes are there with you. In collaboration with them, Dr. Arun Huliavare, you could be able to do lot many research works. Certainly, you take help of some researchers, medical as well as clinical researchers, certainly we could be able to bring out a lot of things. Here, one thing I would like to congratulate and proudly say that Arun Huli, actually like a Huli, he did it a very good job. A very good, wonderful job, I will tell you. An institution, a homeopathic institution started just hardly 3-4 years back, a national conference who could be able to attract the persons from the different states, that also more than 1,300, 350. It's not an easy job, I will tell you. Because as an organizer, I have seen. As a teacher, I have seen. This is not an easy job. And all the people have come just like that because of the love and affection on Arun Huli as well as on homeopathy. They have arrived here. That is his greatness. I think he remembers my words. He said, sir, ನೀವು ಬರಬೇಕು. No, it may be very difficult. Or no, sir, ಹಂಗೆ ಹೇಳ್ಬೇಡಿ. See, that appealing personality, that itself is attracted so many persons from the different areas. One more thing I will tell you. Not only he has trained his team also. You are seeing all these persons, they are not just volunteers who are working here, associate professors, assistant professors, they are working. Their students are there. When we are taking a breakfast or the food, they come and stand like any hotel persons. Is it so? See, that is the culture what they have cultivated here. I never felt that. See, they serve the food and so pleasantly, with heart. That is the thing what I have seen, sir. So, Bagalkot is the first time I am visiting. ನಾನು ಕರ್ನಾಟಕದಲ್ಲಿ ಇದ್ದರೂ ನನಗೆ ಆ್ಯಕ್ಚುಲಿ ಐ ಫೀಲ್ ಸಾರಿ ಟು ಸೇ ದ್ಯಾಟ್ ವಿ ಡಿಂಟ್ ಗೆಟ್ ಎನ್ ಅಪಾರ್ಚುನಿಟಿ ಬಟ್ ಫಸ್ಟ್ ಟೈಮ್ ನಾನು ಬರ್ತಾ ಇರೋದು ಐ ಆಮ್ ವೆರಿ ಪ್ರೌಡ್ ಟು ಸೇ ದ್ಯಾಟ್ ಸಿ ಸೋ ವಂಡರ್ಫುಲ್ ಪ್ಲೇಸ್ ನವನಗರ ದಿಸ್ ಈಸ್ ಸಿ ಇಟ್ ಶುಡ್ ಬಿಕಮ್ ಎ ಮಾಡೆಲ್ ಫಾರ್ ಅದರ್ಸ್ ಇನ್ ಕರ್ನಾಟಕ ಫಾರ್ ಎಜುಕೇಷನ್ ಹಬ್ ನಾಟ್ ಓನ್ಲಿ ಫಾರ್ ಹೆಲ್ತ್ ಇವನ್ ಅದರ್ಸ್ ಆಲ್ಸೋ. This is what I feel. I am very proud. Maybe within a short period, the institute is going to establish in its own way and contribute so many good practitioners of homeopathy to the society. That is my expectation from this. Then, just not I am telling, see, last some 3 months, old BHMA students to the 50 years practitioner, senior most Dr. B.V.V.S. Patel, sir, all these persons have come. Why? Because the love and affection on homeopathy. But it's just for that. And the second name is Bagalkot. Here nothing is there to attract anything. Taj Mahal nahi hai baaju mein. Sabhi aa jao idhar dikhate hai Taj Mahal. Still they have come. Why? Just to encourage the system, just to encourage our brothers, just to encourage our sisters. And so many scientific papers have been presented. As a students' competition, how many you said? 68, 96 poster presentations. It's not easy job. Means they have stimulated. They have actually instigated so many students that I have to present a paper. I have to put a posters in this conference. I have to present something. See, this has been made. And we had a very wonderful speakers like Dr. Girish, Dr. Bindran, as well as yesterday Dr. Krishna. So many persons were there. They have presented their experiences. And by the same time, dear students, seniors I need not say, many seniors are here. Understand the scope and limitation of homeopathy. Because if the name comes, that also to homeopathy. If other thing comes also to the homeopathy. That's why you should be very careful in the society. You should understand. See, accept your failures. Celebrate your success. Remember this word. Then certainly you will win, everybody. And contribute as a homeopath to the national health programs. That your contribution, let it be there. Then even nation also will help you. And be more patient friendly than finance friendly. This is another suggestion for the new doctors. Upcoming doctors are thinking like that, I can open a corporate clinic, we can make a money overnight and have, okay, ambitions are good, but it should be in a proper, I can say the ethical way, then certainly you will stand for long. And one more thing comes, when the education institute comes, sir, we talk about the quality education. If the quality teachers are there, quality education you can get it, and quality doctors you can produce. That's why whenever we say the quality, where naturally there are so many assessments are there, that I was even suggesting him, some assessment may be required to see the institutes, how the quality is maintained. That is equally the important, where we have to go with that. And talk about homeopathy, discuss about homeopathy, prescribe homeopathic medicines as a homeopath. In one sentence I have told. Prescribe the medicine as a homeopath. Just we are talking so many things. Sir was talking about the Panipuri. I will tell you how we can identify the things. Even the last week, a patient came who was a pan chewer, putting continuously, and it is there the habit for more than 25, 30 years. And his son came, he said, Doctor, I have observed one thing in my father's, he cannot eat Panipuri. See, this is very interesting, no? I said, why? No, he cannot open his mouth fully where that Panipuri can be put inside. No, so clear indication. As a son, he is actually second year student of an engineering college. He was telling me, uncle, my father cannot open his mouth. Please guide him. Please scold him. That is next sentence. Please scold him. Then I said, why? What happened? I asked him to open his mouth. Yeah, he cannot open fully. This is the first indication of cancer of oral cavity. Immediately referred and confirmed biopsy, oral cancer. For your information. This is what we have to observe, we have to guide, we have to treat. See, this is a simple example what I gave. That's why our observations, our guidance is very much required in the society. I think Dr. Arun Huli was telling, sir, bega mugsbekri karyakram jorada. See, I wish the institute all the best. All the many budding teachers are here. They have come from the different institutes completed. They wanted to bring up the institute. Please encourage them, take them into your stream. I wish the institute as well as all the students good luck. Wish you all the best. Thank you. Thank you for.
Thank you so much for those appreciating words.
Giving inspiration to young one. We are so lucky that he really found a way to be with us today despite of the distance and his hectic schedules. He has been postgraduated in homeopathy and he has done the postgraduate diploma in the hospital administration. He is the member of consultative committee, that is Medical Assessment and Rating Board, National Commission for Homeopathy.
Registrar, RGHS Bangalore, Dr. Arun Huli, Principal B.V.V.S. Homeopathic Medical College, Organizing Chairman of this conference, Dr. Milind Belagaonkar, Organizing Secretary of the Conference Management Members, and B.V.V.S. Sangha, invitees, Head of the Institutes, delegates and dear students. I am extremely happy that delegates from many states have attended the conference and have expressed their positive remarks about the event. Being a governing council chairman, I was very vigilant of very preparatory work from the conference, and I am happy that at a short time of our principal, staff, students have made a sincere efforts and tried hard to meet all the requirements. I appreciate their zeal and hard work. I am aware that managements of and the heads of various homeopathic institutes have supported the event with a great concern and have contributed for the success of this event. I express my humble regards to all of them. After being the responsibility of our homeopathic college by our beloved chairman, Dr. Virana Charantmat, homeopathy and homeopathic medicines have become a part of my life, and I have been referring my friends and family members to the homeopathic hospital. I hear a good feedback from them about homeopathy that makes the very happy. So I appeal to all the students and delegates to do the sincerely and cater the homeopathic to the masses. Like you all, I got the opportunity to attend the lectures of the resource persons, and I am quite impressed by the scope of homeopathy, and I am confident that homeopathic graduates have a great future. Finally, at the conclusion, I congratulate Arun Huli and this entire team, including staff and students, of their sincere efforts in organizing this conference in a neat manner. I thank Dr. Virana Charantmat, Chairman of B.V.V.S. Sangha, of our management members for their support and their confidence, and thank you everyone here and wish you a great success. Thank you.
Former member CCH New Delhi, former member Central Council for Research in Homeopathy.
Newly elected member of KBHSM Bangalore, former AFI Vice President Belgaum, Director of Court Multispeciality Hospital Belgaum.
General Secretary, Indian Homeopathic Medical Association, District Organizing Secretary, Ayush Foundation, Dakshina Kannada. Sir also served as a President, Indian Medical Association, Mangalore.
I wish to introduce Dr. Munawar Bode, sir, newly elected member of KBHSM Bangalore, President at Dr. APJ Abdul Kalam Education and Charitable Trust, Surpur. AFI Secretary, Surpur. Former faculty member, RGHS Bangalore. Former Vice President, HMAI Branch, Karnataka.
Now I would like to introduce Dr. Sandeep Kulkarni sir, newly elected member of KBHSM Bangalore, Vice President AFI District Dharwad, President KHMA Dharwad District, Vice President Human Rights and Anti-Corruption.
Request all the staff members to come on the dais.
Honorable Chief Guest of the today's function, Dr. Shripad Hegde sir, Member, Consultative Committee. On behalf of our Sangha and college, I express my heartfelt thanks to the Chief Guest, Dr. Shripad Hegde sir, and Guest of the Honor, Dr. Santosh Yadadi sir, and all the respected guests of this conference, for keeping aside their preoccupation and gracing this occasion on our request. On behalf of the entire institution, I would like to thank the presiding officer, Sri Mallikarjun S. Sasnur sir, as any function or event that we host can only be complete with his presence, support, guidance, and encouragement. Thank you, sir. A special mention is well deserved for Honorable Dr. Veerenna C. Charantimat sir, MLA BAGALKOT, Chairman of our B.V.V.S. Sangha, and all the management members of our Sangha and our institution. We are indebted for the trust and faith that you have on us. We have always had your unconditional support in every endeavor, and the name that we have today in the field of homeopathic education has only been possible because of the constant support in every possible way, and for always believing in me and my team. Thank you, sir, is rather a small word to express our wholehearted gratitude to our chairman and the entire management of a Sangha. I would only say that we are indebted to you for being there for us and supporting my decisions. Your generosity means a lot. Without this kind of a support, the trust, such a mega event would not have been possible. Thank you all. My sincere thanks are due for Sri Ashok Sajjan Sir, Chairman Governing Council, SN Medical College and HSK Hospital, BAGALKOT, for facilitating Shatabdhi Auditorium and Atria Hall for our conference. Your support has always been there since inception of our institution. Thank you, sir. I also express my sincere thanks to Sri Siddhana Shettar, sir, former Chairman Governing Council of my college, for his affection for me and a full support in the initial phase of the development of our homeopathic institution. Educational conference is a source of sharing and adding a knowledge to the existing information that we have. Here, I thank all the speakers on a day 1 and day 2 for the conference, for sharing their valuable knowledge to the masses. Thank you all. Now, I would like to thank the chairpersons and conveners for accepting our invitation, adding their valuable inputs, and for carrying out the sessions on both the days smoothly. Thank you all. I wish to convey my sincere thanks to the Senate members of Ayush, Rajiv Gandhi University of Health Science, Bengaluru, for supporting us in every way and strengthening our shoulders at times most needed. Thank you, Senate members, for always supporting us and expressing great concern. I would like to extend my sincere thanks to Dr. Biradar sir, the President of Ayush Federation of India, Karnataka State Branch, by attending this function. I express a gratitude to principals of all the homeopathic colleges who actually deserve it, as you all have supported the conference by sparing your valuable time and have also seen to it that all the PhD scholars, PGs and UG students and interns of your respective colleges take the benefit of the conference. On the same note, I extend my sincere thanks to all the eminent personalities for being the judges for paper and poster presentation. A special mention, a very special gratitude to head of the Bhartesh Homeopathic Medical College and Hospital, Belgaum, Dr. Srikant B. Konkani sir, and his entire teaching and non-teaching staff for everything you all have done for me and for the success of this conference. You have all worked with us for this conference as if you are a member of BVV Sangha. Thank you for helping, advising, and looking after every aspect of the conference. And for guiding us on time, this has really lessened our burden of organizing this conference. You all have worked for this conference as a host itself, and we too have never considered you as our guest. You all are our family. Maybe many a times I might have forgotten to thank you all, but it was never intentional. And sorry if ever I did so. I will never be able to explain how happy I am that you all are in my life. It makes my life easy and happy. Thank you, Dr. Konkani sir and my Bhartesh family. I would like to thank all the delegates from the different parts of India who have shown up in such a huge number. Your presence itself has added to a success of this event. Hopefully, you all have liked the amenities provided, and most importantly, the sessions which were arranged for you all. Thank you. Right from the day of inception of the idea of hosting National Homeopathic Conference, which was roughly around a year and a half ago, all my faculty members joined hands to organize this dream conference and have worked really hard to bring this dream into a reality. I am proud and very happy to head this institution for having a team members like you. I am thankful to my faculty and non-teaching staff for standing by me and to take up my task that I assign. Thank you for making this event a successful reality. I am very much thankful to the owners of various firms, pharmaceutical companies, for contributing through advertisements and stalls. Your monetary inputs have helped us organize this event, and I wish to assure you that our relationships will flourish in future. I am grateful to the heads and faculties of all our sister concerned institutes, as you all have always been there with us at every occasion and have helped us in every possible way. Thank you being our family. Stage and all the technical people of the SNMC have seen to it, and all the scientific sessions went on in a very smooth and uninterrupted manner, for which we specially thank the supporting staff of auditorium and technical support staff of SNMC. Personally, really it needs a clap. Thank you. Personally and on behalf of our institution, I give our deepest regards and hearty thanks to the principal and staff of the S. Nizhalingappa Medical College, BAGALKOT, for their wonderful cooperation and for a support in all possible manner for the past 2 days. We also thank the building committee chairman, Sri Kakareddy sir, and all his staff for providing the facility comfortably stay for our guests at the guest house. Thank you, sir. I would also like to thank the chairman hostel committee, hostel staff, the chairman and supportive staff of Athani and Gauri Shankar Kalyana Mantapa for providing us with the accommodation facilities. Thank you all for the hospitality. I would also like to thank a transportation in charge of our Sangha, automobile section, Sri Ashok sir, for providing us with the required means of a transportation on time, and our catering in charge, Sri Mahesh and his team, for providing a good catering services for 2 days. I sincerely thank people of print and electronic media for a wide propagation and coverage of the event on various platforms. Thank you. I sincerely thank Sri Kalaburgi for a digital screen services, Mr. Darshan and his team for decorating the hall and the premises of a conference. Your services have really made this event wonderful. Thank you very much. I express my sincere thanks to Mr. Siddhartha Patil of Chandraprabha Offset Printers of Belgaum for dedicated work in bringing out a beautiful souvenir of this conference. Thank you, Mr. Siddhartha. I especially thank the central office and their staff for always providing us with all the facilities whenever we asked for it. Not just conference, but all the events that we have organized till date. All has been possible because of your support, and the facilities that you provided us in time. We hope the same cooperation in the future too. Thank you. And now, to thank the most important staff is the cleaning staff and sanitation staff of the Sangha. Thank you for looking after the sanitation and cleaning and for providing us with a clean campus. We are fortunate to be backed by a team of very dedicated students who have worked as volunteers and those who have participated in the cultural events. I cannot thank enough for the involvement of they have shown and the willingness they have expressed to take on the task. Thank you for working day and night for the success of this event. Really, your claps, these claps are well deserved. So when in the March you have a final examinations, when you will come out with a flourish color, so these are very much required for that. Hope you all are benefited and will carry with you the good memories of the conference. Thank you all once again for making my dream a successful event. Thank you all. Announcement with the permission of our Honorable Governing Council Chairman Sri Mallikarjun Sasnur sir. So tomorrow all the students of BVVS Homeopathic Medical College from 1st to 3rd year, you have a guest lecture between 10 to 12. So after that 10 to 12, you have a 1 week holiday. But 16th Monday is a compulsory day for you. And the duty of the teachers